All right, we'll go ahead and call today's work session to order. This is Christian Dorsey, Chair of the Board, presiding. Joining me are colleagues Katie Crystal, Matt DeFerranti, and Takis Karantonis. We expect Ms. Garvey, Vice Chair Garvey, will join us shortly. Today is the 6th and penultimate budget work session in our FY24 budget cycle. It's kind of ironic, colleagues, even though there's not an insignificant number of people in this room, it feels empty, doesn't it?
Miss the crowds.
I'm telling you, it's kind of, anyway. None of you got the missing middle humor. It's amazing.
I did.
All right, thank you. So today we're going to hear presentations from our public safety offices, starting with the fire department. We'll also hear from our police department, our Department of Public Safety Communications and Emergency Management, and we'll also hear from the Sheriff's Office. And we do have also our Fiscal Affairs Advisory Commission, which will have a report and some feedback on the police department's budget. Of course, the board will also have an opportunity to engage in discussion. Anyone interested in anything related to the budget can find that information on our website at www.arlingtonva.us on our budget and finance page. County Manager Schwartz, would you like to kick us off with introductions?
Yes, I would. I'm going to turn it over to Chief Pavlitz, who will make his introductions to some people who are joining him today.
Thank you, Mr. Schwartz. Chair Dorsey and members of the board, thank you very much for this opportunity to discuss the fire department's FY24 budget. I would like to introduce some of our staff in the audience. I'm proud to introduce you to our new Assistant Fire Chief, Jason Jenkins, very experienced, knows the region, and started about 2 weeks ago and is kind of hitting full stride. So I'm very excited how he can help us move the department forward. We also have our Operational Medical Director, Dr. Smith, with us. We have Captain Nate Hine, our Executive Officer, and also Deputy Chief Tiffany Wesley in the audience. And we also have members of International Association of Firefighters, Local 2800 Executive Board. We have President Brian Lynch and son. We also have Vice President Matt Herrera and sons. We also have Vice President Dustin Drum with us also. So thank you everybody much for attending. And Firefighter Tabitha, thank you. All right. So as we load the slide presentation. Got it. Okay, next slide, please. Mission of the fire department, we serve the community with compassion, integrity, commitment through prevention, education, and professional response to all hazards. Next slide, please. Quick overview of the department. Obviously, our mission is emergency response. We try to make sure we match all of our emergency services to meet the immediate and also future needs. We focus on equitable community services, and also, most important, as I'm going to talk later in a few slides, we're seeing an increase of emergency service activities, but we want to try to bring that down in the future, and that's through prevention and also community engagement. We want to see if we can have the public take care of themselves, prevent the incident, prevent the illness, and also not have a need to call 911. If they do call 911, we do prompt emergency services, and then we're also looking at some innovative and novel ways to provide alternative emergency services in the future. To do this, we need to make sure we have a ready and healthy workforce. We've made a lot of investments over the years and will continue to do so. We want to make sure all of our safety and wellness programs are cutting edge, and we're also partnering with a lot of our public safety agencies to that end. I would like to note this is a mandate from Mr. Schwartz and also Dr. Miller that public safety must be integrated, work well together, and that mandate is easy to accomplish. I'm going to say from all levels between Sheriff's Office, Police Department, Emergency Communications, Emergency Management, we work seamlessly together from top to bottom, and it's almost a pleasure. I'm consider we're professional colleagues, but also we're pretty good friends. So we have a good friendly competition trying to provide the best services for the community, but when we get to join and work together, that's when we have some really pretty amazing things happen for the community. We're always looking for the environment to see what's next, and that's a concern. Emergency services and public safety is getting more complicated as the years go on. I think we have a pretty good beat, but one of the themes is we have to make sure we are adaptable and flexible to address whatever emerges. And we do this also on a regional front. We certainly have a focus on Arlington, but we need the support and help of our neighboring jurisdictions, and have a couple exciting things to talk about within the region. I'll profile that later in the slides. So a couple highlights for fiscal year '24. Dr. Smith's going to be one of our presenters when we talk about emergency medical services, and also give a little review of our 1 year in our pilot program with ET3, alternative transport treatment in place and telehealth. So he'll talk about that in a little more detail. I do want to say we've had a great historical relations, but due to the collective bargaining ordinance that was passed a year or two ago, we're having a good cooperative relationships with Local 2800, and we're going to be moving that forward. I'm going to profile a few things, but what we're going to try to do from the collective bargaining agreements that are in draft and for your consideration and resourcing, a lot of the principles in there are going to drive our cooperation and our collaboration for years forward. But definitely focusing on health, safety, and wellness of all responders and everyone in the bargaining unit, and also joint and cooperative with salaries and benefits and other parts of the work state. As I mentioned, we're seeing more and more emergency services calls. We want to try to reduce them. We invest a lot in our fire prevention office in terms of code enforcement and inspection. We're modifying some of those business practices and also supporting systems, and we want to try to bring down all fire incidents, property damage, and things that cause property damage. So we're making progress on that. We're kind of reinventing that process, but we're looking forward to how that manifests in FY '22 and '24, and also years down the road. How we're going to do that. One of the methods and one of our approaches is through accreditation. We started this multi-year process many years ago. We're going to try to bring forth, for your consideration, a few things in terms of guiding our accreditation effort. I would like to ask Assistant Chief Jason Jenkins to come up and give maybe a 1 minute or so brief on what accreditation is, and also your role, assistance, and guidance, and also community engagement of the accreditation process. Chief Jenkins.
See if that button works.
Thank you. Good afternoon. Thank you for the opportunity. Accreditation, Center for Public Safety Excellence, based out of Chantilly, has one branch that's focused on the Commission for Fire Accreditation International. What is that? 3 basic pillars of accreditation. First pillar being a community-driven strategic plan. Community-driven is vital because we leverage our subject matter experts from the community to ensure that our human capital, our resources match the environment we're responding to. We're meeting the needs of the community. It's objective versus being subjective. Second pillar is to look at a community risk assessment. Again, community focused. To take a deeper dive into the community, look at census tracts, look at risk. Is the human capital within the fire department, resource deployment matching the needs of the community? Third pillar being the standards of cover. Are the resources in the right locations to meet the needs of the community? Those 3 pillars, as well as looking at a deep dive into the fire department through a fire and emergency services self-assessment. 250 plus performance indicators. We know we're short in some areas. We will identify the gaps and we will be better. The basis for accreditation is it's a continuous quality improvement process. It's not a one and done, it's continuous. Self-assessment, refinement, efficiencies, and effectiveness.
Far, I'm sure we'll have questions on that, so thank you.
I do apologize for the voice that's going to surround us in a moment. I would like to introduce our fiscal officer, Casey Bailey, and she'll take us through our next slide, please. Actually, stand by, Casey. I advanced 1 slide. We'd like to talk about our community equity efforts, our Racial Equity Initiative, REI. It's a three-pronged focus. We started it about 2 years ago. We've really been enhanced with a lot of the guidance coming from the county and the Samia Bird and the Equity Office. Our community equity focus, we've been delivering ET3 services, alternative transport, telehealth, and treatment in place, and that gives our patients another way to have emergency services delivered. Dr. Smith will be talking about that a little bit more in just a moment. A couple of the prevention methods or measures we're taking are trying to distribute Stroke Smart information, which is a joint program with the Northern Virginia Emergency Medical Services Council. That is to get quick identification, recognition of symptoms, and engage 911 as soon as possible. It's very, very important to have timely response for stroke patients and get them into the appropriate care facility. We also have our Hands to Heart, which is teaching high-effective compression-based CPR. We are delivering those services to Arlington Public Schools and to the communities and to community groups. We're seeing an uptake in interest in those programs, and we will gladly have an excellent team which will travel and deliver that on site. And that makes a huge difference in terms of survivability. And we're also we should be completing a memorandum of understanding for Leave Narcan and Naloxone Behind, which is obviously very important to all of our communities and families. And that is a program we're doing on-site and also in partner with some other organizations. The second prong is department operations. How do we have an equitable and advance the department in terms of our policies and procedures and structures? We are aligning all of our policies through an equity lens. We are also finalizing our 2023 Equity Racial Action Plan. That's in process. And we also have a thriving, very passionate group for an anti-racism effort inside the department. We've had some ups and downs, fits and starts, but that's been a passion project of many in the department, and it's having some good effect. We had a comparative climate survey started in 2021. We're just collecting the data from 2023, and we've seen some subjective improvements there. Some comments are noting that some of our changes are becoming structural, but what's more interesting is the comments that are coming in, we have a lot more work to do. So if we've made advancements of 10 years, we have, we're probably maybe 10 years behind, so we're going to keep doing that. And that is going to be integrated in all parts of the department, external and also internal. Now I'd like to introduce Fiscal Officer Casey Bailey, and she'll summarize some of our proposed FY24 budget changes.
Good afternoon. Currently, we're looking at a 6% change to our expenses. Most of those expense changes are due to personnel increases, salary increases, employee health care expense increases, higher retirement contributions, one-time employee bonuses, and various employee benefits due to collective bargaining agreements. We'll have some non-personnel expenses increases due to one-time funds for heavy equipment replacement, various equipment and supplies due to collective bargaining agreements, and grant program increases. We will also have a decrease in revenue. Most of that is going to be due to EMS and ET3 billing, which Dr. Smith will go over some of those changes a little bit later. Our staffing we are suggesting that we take a reduction in staff to help offset some of our expense increases. Next slide.
Thank you, Casey. I'll cover some of our proposed budget reductions, 4 of them. The first 3 are vacant positions, non-uniform positions. We have an executive assistant in my office. We also have a management and budget specialist position, administrative also, and then a warehouse technician position. We are doing these roles, either distributing the workload or bringing in light or limited duty personnel, but that's kind of transient. They'll come and go. We've been operating with maybe 2 of those vacancies over a year. I think we can continue. The warehouse technician, we are making do, but what we see, what's forward-facing in terms of emergency services, light sirens, ambulances, engines, and trucks, all of that is only possible to a behind-the-scenes effort in terms of logistics support. That is how we were able to continue services through the pandemic. We basically had a very excellent logistical stream in times of need, and that's what we have to operate moving forward. And just-in-time delivery, or projecting what we're going to need 1 or 2 or 3 years out, that takes a very specialized team, and they do an excellent job. Next slide, please. So some key budget considerations. I will talk about what our emergency services probably look like in FY24 in the future. Dr. Smith will talk about some of the community help and preparedness efforts. I'll circle back and talk with some of our public safety partnerships and regional collaboration, and then how we can reduce risk and the need for 911 calls in general over time. Next slide, please. So this is our dispatched emergency services call. Blue would be EMS, red would be fire, yellow would be and other, purple is rescue, and green are hazmat. Those are a smaller population of calls, but the most significant are fire and emergency medical services. So in calendar year 2020 and 21, we saw the pandemic effect. What initially on the front side of the pandemic, I thought we were going to be running more incidents. Everyone was pretty much indoors, and we saw a general decrease in calls, and that was pretty much manifest through all public safety throughout the nation. But prior to that, from 2017 through 2019, emergency calls were trending up. We see a correlation with number of calls, types of calls, everything corresponds with population density. So it's in our corridors. It's where the people are, and it's in where the transit corridors and transit modes are. So it looks like we're back on track or back on trend in calendar year 2022, and we had an increase of over 2,000, or additional 2,000 calls over a high level of 2019. So extrapolating that forward, I think we're going to see an increase in emergency service calls of 2 to 3% over the next several years. As we see Arlington through smart growth, we're just going to have a corresponding need for more emergency services. And with that, I'll transition over to Dr. Smith. He can kind of talk about some of the things we're experiencing in terms of emergency medical services. And I'll ask for next slide. He'll talk about some of our EMS practices and specifically what we've learned and what we project with telehealth and treatment in place. Dr. Smith.
Hi, thank you for allowing me to sit down with you guys. If you remember, we started this program called ET3, which was it's a CMS of Medicare program. We've expanded that beyond CMS because CMS is a very limited application in our community, and we have a fair amount of people who fall into the CMS category, but we also have a lot of citizens who don't, and so we expanded it to what we call the all-payer base. What we've seen over the past year, it's been a fairly successful program with a bit of a slow launch. A fair amount of that launch has to do with the regulations around CMS and around the Virginia Department of EMS regulations to get things up and running. But we're fully implemented now, and we have a good program. We're probably interacting with the community via telehealth somewhere between 5 and 7 times a week, and I expect that to go up. Some of that is that the citizen has to be aware of it, so we're working on a marketing campaign, a PR campaign to say, hey, this is available to you. You can see the breakdown of our total telehealth calls for the first year is about 172. We're pretty successful at our treatment in place, and what that means is that we come into your house and we say, we can take care of your problem here if you like, and offer the telehealth services. We bring a qualified health practitioner on the video screen and treat you, and we'll call in your prescriptions, and we have 100% quality assurance, so we call every single patient back the next day, ensure how they're doing, and making sure we get good follow-up. We also use this, people refuse to go to the hospital sometimes. They don't think they need to go and they're really sick. And so we use this as a way to say, well, would you like to talk to the doctor? The doctor will tell you that you need to go. And so it helps us convince people who are at high risk for problems, who don't maybe understand that there's really high risk, to the point we've had people who are having heart attacks say, well, I don't want to go to the hospital. So we're able to convince people that, hey, listen, this is real, you need to go. And so we use it there too. You can see our, the telehealth calls, our distribution of telehealth calls is really South Arlington. It's kind of middle and South Arlington. We don't get a lot of calls from North Arlington. And I think that when you look at the distribution of the population and the income in Arlington, really where our calls are being used are the people who really need some access to health care, kind of less, the underserved population. So we have some immigrant population that accesses this, as opposed to North Arlington, where they have, a little bit better resources. And so that's great for us, is we're able to bring care to people who may be uncomfortable going to the hospital and providing that access to health care. The biggest thing with this telehealth program, I think the benefit to our community, and is that the cost of a telehealth visit versus the cost of going to the ER. When you walk into the ER, no matter what your problem is, when you say hi to the nurse, you sign in, they charge you $750, period, right? That's just the first charge. The average ER charge for, let's say, a cold is about $2,000. When we see a patient, our billing practice is roughly $200 for a telehealth visit, and then we only bill insurance. And so it is, again, it is an ability for us to provide the same level of care they're getting in the ER. They never have to go home and have to worry about getting, leave their home and getting work in a taxi to come back. It allows us to do great. The issue has been around billing. The billing, so we did not have a billing specialist. We've self-taught ourselves how to bill. Our program manager is amazing. What we've realized is that anytime you submit a medical bill, they reject it at least twice, no matter what, right? Hoping that you'll forget. Right? So it takes about 3 or 4 times to put in that bill and get it paid. We now know how to bill Medicare. We're billing Blue Cross Blue Shield. We're successful at billing Aetna. Some of the other payers, we're still working with Kaiser and other, they have a whole separate system that you have to learn. And so we're struggling through this. We do have a year to bill, so we probably have somewhere around 60 or 70 bills that are in the process of being rejected 3 times before they'll pay them. And so we're working on that. So there is, and we're getting better at it. And so that's really in that income that we projected, we basically a little bit over projected our ability to bill and the ability of the payer base, because if we don't have insurance, we won't bill a patient if the patient doesn't have insurance. And so we provide this service for them, and if they have insurance, we will bill them. If they don't have insurance, we don't, we allow it to, we don't send them a bill for the telehealth piece. So that's that little bit of a gap, but it's been very successful. I think there's other places in this region. I was on a call for about an hour from a place in California. They're sending their people to work with us to learn how we did it, because it is really the wave of the future in EMS. It keeps people out of the ER. It provides access to service, things like that.
Dr. Smith, could you expand on where some of the things we've learned, some of the things we have in place can be used in the future in terms of partnerships with the...
Oh, yeah, sorry. Where we are now is moving the telehealth forward to provide, so we have with the CIC, the Crisis Intervention Center, so we're working with them now. Our goal and expansion, we're in phase 1 where we can bring a patient directly to them, keeping them out of the ER. So working with them to bring the patient. And then the next phase is everybody who if you have to be admitted to a psychiatric facility for your crisis, you have to have medical clearance. And that usually involves going to the hospital and sitting in a stretcher for about 24 hours because they're busy. Well, we're going to bring this service to the patient at the Crisis Intervention Center, be able to do the proper lab work because we carry this equipment with us, and then use telehealth to provide a medical clearance. We're looking to work with the jail as well. We're looking to work with our some of our rehab facilities in the future is bringing these services to keep those patients out of the ER and providing the same level of service without ever making them go to the ER, where generates a huge bill and it's typically overcrowded and other things.
Thank you, Dr. Smith. Next slide, please. One of our constant concerns, and I believe you've heard this also, is how are we staffed? We want to make sure we have the responders to deliver all these services, and certainly what we're going to be looking like are some of the challenges we're going to be seeing in the future. Our staffing vacancies have kind of been up and down, seesaw pattern, but overall it seems to be pretty steady state. We had low attrition and separations in calendar year 2022. We know we have more scheduled retirements in 2023 and also some unanticipated attrition. But then I think right now, by scheduled attrition, we should be lower in 2024. We're coming off of full staffing. We do have a recruit class selection process in place. We should be starting class in May, graduate in November, and that's just going to be a continual process moving forward. On average, we have about 22 to 24 separations a year at an attrition rate of about 2.3 per month. We kind of think that's going to creep up a little bit and then maybe decrease in the next 2 years. But overall, current vacancy right now is 6%. But what we're hearing and what we're bracing for in a lot of our surrounding fire departments, the job market, the labor market is becoming very, very competitive. There seems to be less interest in all hiring processes. We're trying to bring in the best applicants we can, but it's very, very competitive. Everybody wants the top end candidates. So we're seeing this across the Northern Virginia region. We're seeing this across the National Capital Region. Right now, we'll learn a lot from this recruitment cycle, and we'll make some changes and adjustments as needed. So next slide, please. To focus on some of our FY24 fiscal management principles, we want to try to do everything we can to recover more fees, but also cost containment. And overtime is one of our biggest cost items. That does go back to staffing. One of the solutions for overtime is to make sure we have full staffing and available personnel to work. So we have to make sure we're ready. We have to make sure we're healthy, and we have to make sure we are safe and available. So trying to manage some of those programs to prevent injury, also to provide the right policy management. Those are the things we're going to focus on, and also to make sure we have the incentives for recruitment and retention. We want to make sure we keep as many of our good personnel that we invested in year after year. On the revenue side, trying to increase revenue, we're going to bring to you probably, maybe this year or maybe next, the Virginia 2021 State Fire Code. There's a little bit of an offset, but that's the most modern code. I think about a year or two ago, you adopted our Arlington County Fire Code, which was the 2018 Virginia State Fire Code. With that, and also a revised business process within the Fire Prevention Office, we're probably going to request a fee schedule change to some degree to make sure we're within the region, but it's also the appropriate fees for the services and inspections that we provide. We're also tracking and studying EMS billing. We're going to make some adjustments. We kind of know what some of our partners are doing within the region. We're kind of keep pacing with one or two key jurisdictions. But as we change our services, we may make some adjustments to some of our EMS billing fees. But we're definitely focused on making sure we have the right internal controls, internal audits to recover as much of that fees and much of that revenue as possible. So we're still learning of that as we analyze the data and the practice. And also from the collective bargaining agreements. So this is year one with implementation of the collective bargaining agreement and 3-year contract. We have some of the costs anticipated, but some of the things we're probably still going to come across in terms of joint partnerships. I'll talk about one or two in some future budget considerations. This is what we're going to work collaboratively with and make sure we make the right research and purchases to keep all of our responders safe and secure. And to that, we'll transition to future budget considerations. So maybe 3, 4, 5 fiscal years out as Arlington grows, and we appreciate your consideration for a 10th fire station on the west end of Columbia Pike. We're going to need to staff that station with 21 responders to have at least, doesn't necessarily have to be there, but adding to the system, a 4-person engine company and a 2-person transport unit. We have some options to hopefully help fiscally support that if the FEMA SAFER grant, Assistance to Firefighter grants, are reauthorized by Congress. That's a big push right now, trying to secure that for the next several years. Hopefully that will be available. I think we'll be a very good contender for that as we're establishing a new service to serve the community in an area on West Columbia Pike, which has a little bit of response time gap. We do provide very quick services coming in from the east, north, and south, but it is a heavily reliance on one of our automatic aid partners. Also, what we know, we're still learning about cancer prevention. We've come a long way, but one thing we're addressing, or one thing that's going to be probably an upcoming additional cost, is our personal protective equipment, structural firefighting gear, the barrier garments, the protective fabrics have PFAS chemicals, so forever chemicals in it. Those carcinogenic chemicals, while they do have an impact to our health, the immediate dangers to life and health environments we enter in terms of fire are much more harmful. So the second manufacturers, or the second that some developers make the safer garments, there's going to be a mad rush within the fire service to try to implement those. So we know that's out there. That's probably going to be a large capital purchase. But once we have and get some bearings from a joint collaborative labor and management committee, and we are studying, researching, and talking to the specialists. Once we get some directions, we're probably going to make a request to see if we can turn out or change our structural gear as soon as possible. We want to make sure we maintain a competitive hiring stance. We want to try to be 1, 2, 3 in the region. And also we retain all of our key employees. And that's the continual conversation with competitive salaries and benefits. We appreciate your consideration through this collective bargaining process. I believe we're close to some agreements, but I'm excited how we're going to be able to implement return to a first contract in Arlington. And we have a lot of good agreements on items, and certainly in terms of health, wellness, and safety, and a lot of our policies and procedures. I mentioned before, we are looking to expand automatic aid. I talked to my counterpart in the District of Columbia this week, and the intent is from some regional investments in the National Capital Region as we are connecting our computer-aided dispatch systems. We've done this in the Northern Virginia region 10, 15 years ago. It's been expanding through Maryland, and now we're in the last few months of connecting the District of Columbia into the same system. That will provide the mechanism for automatic aid or mutual aid enhancements. We're in discussions. That's going to take a lot of coordination, but I welcome the District of Columbia Fire and EMS services to come across the bridges and vice versa. As we and also the district experience more increased calls for services, we're just going to have that cooperative assistance. That's one of the things we're going to be able to help resource emergency units into Roslyn and vice versa into Northwest DC. We're operating pretty well now on the bridges. Now we want to go a little bit deeper into each of our jurisdictions. I think that could be mutually beneficial. I'm going to say thank you to the Department of Technology Services and also Public Safety IT and all of our public safety partners. It's kind of exciting. We are engaging in trying to fully use the technology we have in hand and also looking to future technologies to help our administrative functions. That's necessary as we're having more and more pressures to do more with less, but also how we can operationalize this for responder safety and just providing better services to the community. So we're piloting a few things, we're testing a few things, but that's going to be one of the strategies we're going to probably benefit from with just a great collaboration within public safety and all of our information and technology services. As we talked, also expansion of the new novel services in terms of emergency medical services, increasing telehealth, partnering with Department of Human Services, Sheriff's Office, Arlington County Public Schools. These are the things we can do. We have the ability to do now, and we find these modular solutions can be applied in different areas for mutual benefit. So I believe we're going to be able to have more and more conversations, sign more and more agreements, and deploy more and more services over the next several years. So thank you very much for your consideration. Glad for any of us to answer any of your questions.
Thank you so much, Chief Pavlitz. And colleagues, questions? I'll be happy to, go ahead, Mr. Carantonis, you can start us off.
Mr. Chair, you can tee us up.
Sure. I've got a number of them, so I'll pick which one I'm most interested in to start. Do an easy one to start. So Operation Fire Safe, which is something that always sounded great to me before, but we suspended it during the pandemic, and I understand there are no plans to continue it within this budget. Is there a programmatic reason it wasn't as effective? Is it too costly?
We're going to pivot away from visiting individuals' homes, which we still do. If anyone calls and has a question on a fire detector, carbon monoxide detector, we'll go, we'll assist, we'll help, we'll install. So it's more on demand. So we will, if it comes into as a request, we're there. That's going to happen. We're just not canvassing or blanketing communities. What we're talking about and hope to design is more of a social informational help serve, here's the video, kind of go through this. Basically, it's a bot to help answer questions and also provide this video, consider this and do this, and let everyone in their homes do a fire safety inspection, have an escape plan, and then also check their smoke detectors and carbon monoxide alarms. So we're going to try to use, when we think Arlington's going to be very receptive to this, it's a very smart community, we're going to try to use a different approach to communicate and also inform, educate, and allow Arlingtonians to help themselves. So the numbers by a metric have decreased, but we are still making sure early detection is installed to anyone who requests it.
I mean, that does all sound very cool. And I recognize it's not the most efficient way of doing it, but I think about the many Arlingtonians who are not able-bodied, who may have these detectors in inconvenient places, and I heard from a couple of them over the years, who very much appreciated the fact that there was, a young, knowledgeable person who was able to, in one case, I remember this discreet, just change the batteries because it wouldn't have happened if someone hadn't come by to do it. So hopefully we're making sure to not just solve for the smart Arlingtonians who can pull this all together, but also the ones who really rely on the human touch.
Yes, sir.
Yeah, that's where I was headed to, so I'll just pile on a little bit. Because it seems to me that people who don't have fire detectors or don't have functioning fire detectors are most likely not the people who are online and check in videos. So I think you all probably get calls to some of those homes, and there's probably maybe through DHS an idea. So I guess what I'd like to suggest, and it's way out of my swim lane, maybe there's a way to triage a bit and work with DHS to find homes that are more likely to need a visit, possibly.
Yes, ma'am, we can do that on the identification, and then we will bundle the options, the ability, or the call, this number. We will try to package that with a lot of our other outreach in terms of Smoke Smart or other things we can do for the community.
Yeah.
Yes, ma'am.
I think there's nothing like somebody knocking on the door, as you said. Yeah.
Mr. Karantonis.
Thank you, Mr. Chair. Just to add to this, I visit several also in apartment settings. I know that the department is active. I know that the fire marshals visit, etc. But there is a need to indicate where, check that your fire detector works, etc. And more than English, an additional language than English, just for people to be able to be focused on checking periodically on that. So that I think is a good thing to promote. I wanted to ask something different. That's on the budget presentation, for which I thank you. It's on the actual budget narrative. So on the performance measure, can you explain to me or refresh my memory on why the critical measures in terms of average response time, et cetera, have been creeping up across the board?
Correct. We're going to revise these numbers. There was a change in information system reporting and also what it looks like at first glance. There was average numbers stated in FY 19, 20, and 21 actuals. What 22, 23, and 24 look like are the 90th fractile. That's kind of the upper edge, and my guess is the average would be closer to those levels. What we're seeing is in terms of travel times, our turnout times, so the time we're notified by an emergency, and also we start wheels turning or we start in motion, those measures, what we're seeing year after year, are pretty stable. They're pretty normal. They're pretty consistent. We're hoping to reduce the overall response time or the overall travel time with the addition of the 10th station in the west end of Columbia Pike. That will bring down our travel times, because we know there's some sections where we're just kind of, we have a little bit of a gap in terms of our ideal 4-minute, 240-second travel time in portions of the Columbia Pike and also up South Carlin Springs Road.
Yeah, but okay, so these will be revised,
Yes, sir.
fine. I understand it perfectly. I also understand that our cooperation with our neighboring fire departments, they count here because this is also response time, right?
Yes,
If they
they are.
arrive first because they are closer, the incident has been responded to. And I have to say, and still also 50% of calls are responded in less than 4 minutes, and that's accurate, right?
Are you asking?
50% of responses are less than 4 minutes.
I'll have to confirm that with you. Is that in?
I think it says 4.
I think that I read it in the budget. I cannot
in the
tell you
budget,
where.
right.
But anyway, this is not important. We can talk about that offline. For me, it was important because, I mean, the significant responses of the department that I have observed were well under 4 minutes, actually. Not to mention the 4-mile run response, et cetera. That was really, really very quick, and it saved lives. Thank you for that.
Yes, sir.
Thanks.
So just to be clear, so these numbers that we're seeing presented are going to be revised?
Yes, sir.
Okay, thank you.
So just to
Ms. Garvey and then Mr. DeFranti.
I'm just assuming you're going this way. Thank you. In years past, I think particularly Dr. Smith has talked about possibly putting EMTs on a motorcycle to handle traffic, get there faster, and I gather that sort of hasn't worked out. It always sounded like a really good idea. What's happened with that?
Well, so the concept is getting there quickly, and when you look at it, sounds great to be on a motorcycle, and there's a fair amount of our firefighters that would probably love being on motorcycles, myself included. But it's actually not realistic, because if it's raining, you have to have another vehicle. It ends up actually increasing the number of wheels, and it's not as golden as it sounds. So what we've looked at is our deployment model to say, how do we get someone to you as quickly as possible? And we're actually, we've adjusted some of our response algorithms to say, if there's a fire truck that's close to you, there's an ambulance that's farther away, we're sending that fire truck because at least that fire truck is staffed with people who are trained, professional, and they can start to take care of your problem while waiting for that ambulance to come. So, so we've addressed the concept around motorcycles was getting someone there very quickly. We're getting people there quickly. So we've been able to adjust for that.
Thank you.
We do use all-terrain vehicles and bicycles during special events. If there's a dense crowd, that helps with mobility. So we're able to at least get small mobile first assessment responders in all of our events we have in the fall.
Okay, great. No, I assumed that it was something like that. It did seem to make sense. Next time you'll tell me you're putting them on horses every now and then for big events. That would be fun. I've got more questions, but I'll
Yeah, we'll
yield.
all have multiple rounds. Mr. DeFerranti.
Thank you, Mr. Chair. So I'm glad to see the diversions are up a little bit, and I'm not quite sure how those fit with whether you're able to count a diversion through telehealth. But I guess my biggest question is, can you say a little bit about how you might get the word out more? My sense is that there are communities, when I lived in a condo, 3 doors down, I didn't know the person, but now I know neighbors more closely. And then there are apartment buildings where everybody in the building knows every other human being in the building. And so I'm just curious if you've thought about how you'd market to particularly communities where we have a little less service like where Station 10 might be.
The government program, the ET3 program, has requirements with public relations that they have to approve it first. And so that process, just like everything else with the U.S. government, takes some time. That's putting it nicely. For example, we just finished a film on the Arlington TV that has putting this information out. So we have a variety of ways working with our PIO, working with Captain Heiner, just to reach these communities. The biggest impetus in some of our more diverse communities is a language barrier, and the technologies for real-time translation of language across telehealth they're new. They're still relatively new. And so we're working on that. We have a couple of different vendors we're looking at, some different options. So that's one of the barriers that we have. The other issue is that you have to be a willing partner, and there's a fair amount of people that don't understand that this is so we have to convince people that this is really good for you, this is the same. And so it's a cultural change. And as I study with other agencies, Austin, Texas, Cincinnati, these agencies and colleagues of mine that are doing similar things, we've all seen this same very slow growth, and then it hits kind of a precipitation points, and then it takes off. And that's really the process of change in the community, is making it okay, or they understand, oh, I can do this, and this is real. I think, the only good thing that ever came out of COVID was we realized we can do stuff virtually. And so but there's still segments of the population where it's still a little uncomfortable. And so we're working on that messaging to make sure that people understand this is an option that you can have. I do anticipate, next year or the year after, we're going to have hit that precipitation point and be extremely busy.
Great, it's really helpful, and board members can, by anecdote, think that they know things, and so I'm just going to, there was the vaccine rate. There were 6 leaders with the ASHPA, the South Arlington Hispanic Parents Association, who I think they probably got vaccines for 2,000 plus people, and so they have this massive WhatsApp network, and I just think that might be a specific suggestion that might help you hit that precipitation point.
Thank you, Ms. Crystal.
Thank you, Mr. Chair. A couple questions about attrition on slide 11. So this is important, of course, because of what it indicates about the health of the fire department and the men and women who service there. It's also important for the dollars and cents reason you noted, right, that one of our major cost containment strategies is keeping mandatory overtime to a minimum. It looks anyway in the data like there's something of a cyclical pattern, and I'm wondering if that's just a mirage and sort of an accident, or if you see it. I mean, I know I'm thinking, for example, I think it was around 2017, 2018, we intervened with a pretty significant budget plus up with the idea that ultimately it would be sort of most cost effective to try to put a real infusion into compensation to reduce the amount of overtime. I don't recall us doing sort of similar things around other times that peaked and then led to flow to ebbs. Is that just sort of a mirage? It's how it's played out, or are there certain cycles and ways that we can intervene to address it?
It's hard to say, but I will attract attention to calendar year 2022, the reduction, we were around 20. But that was the start of the Kelly Day Reduction of Work Week initiative. So the investments that the board and the cooperative work between the fire department and local 2800 had a market effect, because that was, we're gearing up, it got here. And then we saw a lot, well, everyone retained, everyone saw the benefits of it. It was a great balance, work-life balance program, and we saw a lot of reductions, positive reductions in terms of sick leave, injury. It had, I think, the intended benefit. Something happened in the fall of 2022 that manifested across fire departments throughout the region and the nation. I believe we went back to school. I believe we went back into work, came out a little bit out of the pandemic, and there was just a general sickness. I think 2 years being not in circulation, then we all came back. That had a marked impact on the workforce, on all firefighters, EMT officers. That triggered a bunch of vacancies, which then triggered overtime, which then triggered mandatory holds. And that's what we want to reduce. We want to try to make sure we do everything we can in terms of resourcing policy, practice, scheduling to reduce mandatory holds, because that's crippling. You want to go home. You put in a hard 24-hour shift, you want to go home.
Yeah.
So continuity service, minimum staffing, sometimes it's not always possible, so we're trying to bring that down. But the investments that have been made in terms of benefits, compensation, reduction of work week, I'd say they show in the chart, but the cyclical year after year, it's kind of hard to.
Randomly.
It does
how
look
the-
up,
how
down,
the
up,
data
down,
has
up,
arranged.
down. We can't really identify why.
That's really helpful. Thank you. Also, in terms of driving down that mandatory overtime for, I think, the reasons you just articulated really compellingly, do you have generally a sense of what vacancy rate correlates to a sort of de minimis or healthy amount of mandatory overtime?
If we're authorized 375, if we are short around 30, 40 for any particular reason, either by attrition or probably around 40 to 50 by situation or circumstance, by sick leave, by medical leave, by injury, then we start getting to very tight staffing conditions. And then we see the overtime increase, and then that's exposure to the mandatory holds.
Absolutely, which perpetuates a higher vacancy rate, I imagine.
Yes, ma'am.
Really helpful, thank you. Mr. Chair, I don't have another round, but I will just take the opportunity before I yield to say particular thanks. I know the manager will kick me if I indicate anything's too imminent, but I know there have been some conversations about the conversation of street width and fire equipment, which has been a strong interest of a lot of parties in our community. I know there's nothing ready to roll out yet, but I wanted to in particular thank you, Chief Pavlitz, as well as our fire marshal and others in the department for having that conversation as we try to balance those really key goals of public safety and also, streets that are themselves configured in a safe manner. So thank you for that work.
Thank you. That last comment addressed my next question, so I can't ask it now. Thank you, appreciate that. Well, actually, it's not even really about that process, but more about the industry itself. Given your overwhelming shift towards emergency response, which I know is not Arlington specific, it's general industry trend, and I know that you still have to have fire trucks in the event that there are needs for all of that equipment, but is there a general industry movement towards looking at making those things more compact? Everywhere else you look, people are trying to make, batteries smaller, devices smaller. Does that same ethos exist in the fire equipment apparatus industry?
The industry has tried to optimize the current side, that the competing pressures are cost, design, and performance. So the wheelbases have been shortened, turn angles have been shortened, or turn angles have been increased. There's everything they can do on the engineering side to get these large vehicles into all the places they could and should. The competing forces are, we have to carry an incredible amount of equipment, and it seems to be increasing year after year, day after day, to handle anything and everything that happens. So the European model, the European design, this system is built totally different, from codes, construction, to streets, to the way they staff and the way they place their stations. It doesn't translate too well. We will always try to make sure we have the safest vehicles, and we are very, very, very proud of our fleet. Can't thank you enough. We have one of the, I'm going to say an enviable fleet. It's in a great state. But the size, it's that bigger, smaller, faster. We're doing everything we can to, we really can't do much on the width. That's not a, we can, on the length and turn angle, they have a little bit more flexibility, but in terms of the width, it's, the vehicle itself, it's kind of challenging in the American fire apparatus market. We are looking in the future to maybe have a hybrid introduced in the fleet with our heavy fleet within the fire engines and fire trucks. The technology for a pure electrified vehicle is still in its infancy, but the cost premium is significant. But that'll come down, and we're just kind of, we're watching, we're waiting, and at some point in time, we'll be moving in that direction. We're doing it on our lighter fleet, on the smaller vehicles, but at some point in time, we anticipate the first hybrid fire engine.
I don't even want to have the conversation about what would be the replacement ratio necessary for an electric fire vehicle that you have to have out of service while it's charging. That, glad we'll be off for that conversation.
We almost had
And
this
how much it
conversation
weighs.
at the last CIP, I believe. This was the moment. I mean, I guess you have been purchasing the vehicles, the new vehicles that were approved with, the CIP from last year, the decision, right? Because you asked, was it 8 vehicles? I don't remember how many, but it was a number.
I don't know the number, yes, sir.
Yeah, I visited the city of Cincinnati, and they told me that our vehicles are fantastic. And so, but yes, they are very, very, I mean, the issue of the width is a significant issue as we go. More municipalities are seeing that as a significant problem. And I think we are beginning to see that here as well in serious terms. Thank you.
All right, so that's your last piece, Ms. Garvey?
Oh, I have two more.
If you can get them out
Sorry.
quickly,
I
that
can
would
get them
be
out quickly.
terrific.
While we're on equipment, drones? We thinking about drones?
We are,
I mean, a lot safer to send a drone in than a person into a burning building, right?
Yeah, might want to give them more specifics there. You probably.
I mean,
within all the public safety departments, we are studying, working on it, and we're in conversations with the manager's office.
So I will be to you at some point, not in the next week, but in a couple of months, with a comprehensive proposal on drones. We're working with our colleagues in the National Capital Region who've done a survey. They are fantastic additions to any fleet. We want to make sure we address the privacy concerns, which have been, I think, successfully handled in other jurisdictions, but we absolutely would, in many cases, would prefer not just for fire, but for police and also for our building inspections to have the ability to have drones. And that is in the National Capital Region presents additional challenges given about how you have to get permission for drones. But I'll be to the board and the community probably in the next few months with a full proposal on that.
thank you. And then the other question, which I apologize because I came late, you may have discussed the eliminating of there's a vacant position on management and budget specialist, and the reason I'm asking is the last thing you say, it greatly reduces your capacity to take on new grant opportunities, which I'm worried, I mean, sometimes these positions pay for themselves, and maybe we have a countywide approach to grants, I don't know.
That's something we're going to have to try to compensate for. Right now, it's a team approach. We are scanning the horizon. We're trying to see what we can to bring in grants. We do have several applications out, and we anticipate some of the larger ones, hopefully with a Staffing Safer grant in a few years. Right now, it's a team approach. I don't think we're probably not losing anything, but we may not be totally employing all or engaging in all opportunities. It's
Okay,
safe to
well,
say.
I hope we're not missing too many. Thank you.
No, ma'am.
Yeah, and that's a vacant position right now.
Yeah, it
right?
is.
Yes.
All right, well, thank you. We're going to move this along because we do have some other agencies to get to, but we very much appreciate it. I'm going to follow up with you, Assistant Chief Jenkins, on the accreditation process and how that's going to be community-facing, so look forward to that, or fear it, I don't know, whatever your point of view, but thank you very much. Appreciate it.
Thank you, Chair Dorsey, members of the board. Thank you.
Thank you so much. Your flashlight is on your phone. Oh, thank you. Thank you. Appreciate that.
Clearly, Arlington is very
Appreciate it.
Thank you, Chief.
All right. All right, welcome Chief Penn. Deputy Chief Cassidy, how are you both?
Great to be here.
I don't want to take the manager's thunder. He may have an introduction more formal than that.
You're excited to be here?
I am.
Go for it.
Okay, good. So I want to start with acknowledging the other folks who are here from the police department with me. Deputy Chief Cassidy, Deputy Chief Drew, Deputy Chief Vincent, Deputy Chief Chamberlain, and our budget manager, Amy Costanzo. So happy to have all them here with us. And I'll jump right in. So I'm nearing the end of my second full year as the permanent police chief here and about to begin my 32nd year with the Arlington Police Department. And it's important to me to say how incredibly proud I am and humbled to serve in this role. I continue to believe that we have an exceptional police department, and that's due to the incredibly dedicated and professional staff, both sworn and civilian, who make up the agency. Last year, I shared with you the information that I learned in the conversation with the chief events that I held shortly after being appointed to this role. So I wanted to close the loop on some of those, and I'm going to focus on the two areas of improvement areas and future priorities, just to share with you some of the things we've done from hearing from the community in these topics. The first improvement area was increasing communication. So we now have a monthly newsletter that we send out that covers all the 4 key initiatives, tries to touch on everything that we do and provide a robust look at the workings within the police department. Last year, we returned to hosting 3 community police academy sessions, reinstituted the public safety block party, and as you're aware, we formed a Latino liaison officer position. The next improvement area was to more focus on crime and traffic enforcement. So as you're aware, we're increasing some of our electronic enforcement efforts, photo red, photo speed. In addition to our on-duty traffic education enforcement, we do have overtime details to focus on transportation safety throughout the community, and we continue to actively participate in all regional safety traffic campaigns that occur. Some of the future things that were suggested were focused on police staffing, career opportunities, well-being, and retention. So our recruitment team, as you heard a couple weeks ago when they were with you, has become very innovative and aggressive in how we recruit. The days of job fairs are well past us. And so that's an important part of that work, coupled with the salary increases that our employees have received from the county, and our focus on internal work-life balance enhancements, which include our wellness program development and expansion, and we're now looking to develop a non-supervisory career path for our employees to continue to engage and allow people more opportunity. The next future suggestion was focusing on addressing changes in crime trends. So we've always collaborated regionally with all of our local, state, and federal partners, but we've continued to really focus on this area. Much of what we're seeing is occurring throughout the region, so we're really invested in working with all of our partners, and we're beginning to look at other opportunities or technologies that can assist with enforcement efforts. We have a staffing challenge, so what can we do to assist us beyond manpower? And this fall, we're going to be starting a new statistics-focused detail to really allow different people to rotate through this opportunity and spend time focusing on challenges that are happening in specific parts of the community, whether it be engagement or crime issues or transportation safety. So that's going to begin rolling out in April or May. The last future-focused area that was pointed out repetitively to us was removing police from the mental health issues and issues that do not require a police response. So, with the state challenges of having mental health hospital workers and, the Department of Human Services has challenges, we find ourselves probably spending more time with mental health issues, people that need mental health care, or they're under an emergency custody or temporary custody order, and officers are spending, up to 1, 2, 3 days with these folks. So it's obviously a staffing challenge for us, but really critically is that the person's not getting the help they need, just sitting and waiting for a hospital bed to open up. So something I'm really excited about is we've worked all year with the Department of Human Services, and the Crisis Intervention Center will be opening as a place where our officers can take somebody who's under a custody order who needs mental health help to the Crisis Intervention Center, leave them in the custody of the security officers. So they're going to be, their safety and welfare is going to be looked after, but they're also going to have access to human services folks. So that's something I'm incredibly happy about that's moving forward. I'm going to move now into our crime control and prevention. So next slide or 2. This one. So we have 4 key initiatives that guide everything that every member of the agency is supposed to do, and everybody must contribute to these, from me to the newest officer. And I want to touch on each very briefly just to highlight a couple of points. On crime control and prevention, I truly believe Arlington remains a safe place to live. We are seeing increases in crime, so it's critical that with our reduced staff numbers that we're very efficient and smart in how we deploy the resources that we have to make sure that we are in a constant state of preparedness and readiness and focused on the more serious criminal incidents that are happening throughout the county on any given day. In our transportation safety initiative, this is our work to make our roadways safe for all the different people that use it. We've always taken a two-prong approach, education and enforcement. The goal is to correct behavior, so if we can do that through education, that's the goal, but enforcement has to be a part of this work. One of the things I wanted to close the loop with you on is this board approved transportation safety specialist positions, 6 total. I'm happy that function is fully staffed, up and operational, and they have become a very positive addition to our work in transportation safety and supporting all of our initiatives in this space. We actually took a vacant position we have and converted it to add one to that position, to that work, because it's really showing positive work for us. On the conversation of expanding the photo red and photo speed program, there's an RFP that's going to close next week for combining both of those. So my hope is that we'll have a contract for both within the next couple of months. And we're almost at the finish line with VDOT on the photo red expansion. There's a couple of intersections. We're almost there. We should be there soon. Under community engagement, the police department's done community policing since the 90s, but this is the first time we've had a dedicated division that focuses on this. And our goal is to continue to participate in the organized meetings and the things that we've always participated in, but to get beyond that, to get into the community where people are, to make sure that we're trying to engage with every part of this community, every member of this community that wants to engage with it. And I think they've done incredible work over the last year. We divided the engagement division up into 3 different parts: community outreach, business outreach, and youth outreach. Since we're not in the schools any further in an SRO capacity, it was important to us to continue to have a focused connection with young people throughout Arlington. So I wanted to just share some of the things that have been done in that work over the last year. We had our first ever Teen Police Academy, and this was for high school students to spend a week together and talk about law enforcement as a profession, talk about how we police, and to try to build interest in future police officers in this community. I think it was successful enough that our plan is to have 2 same sessions next year, and we're going to try to build that into a cadet program to keep people engaged with us between high school and when they can officially become police officers. So I'm excited about that work. Some of the educational opportunities that we hosted over the last year include things, conversations about bullying, drug and alcohol dangers, know your rights. We have a tutoring program for first grade students that both sworn and civilian members of the police department participate in, and we formed a partnership with the ARC of Northern Virginia to have an opportunity for people with disabilities and family members to come out and experience a mock traffic stop, a mock accident. And these are just some of the examples of the work that we've done to try to really engage with the youth over the last year. The final key initiative is wellness. We continue to focus on our wellness initiatives throughout the agency to make sure that we're doing everything we can to support and provide services to our members, the people that we ask to go out and make a positive impact in the community. So I'm going to talk a little bit more about this later, but some of the highlights from 2022 is we created the first ever Office of Wellness and Safety within the police department, so it's a section within the police department now. Our peer support team was reaccredited last year, and our plan into 2023 is to add a human performance specialist to help us with our organizational development and wellness as we grow through the next couple of years. Next slide. Next slide, please. So for the police department overview, as I mentioned before, we're really fortunate to have incredibly dedicated and professional staff members. Every day, our officers demonstrate their unwavering commitment to the safety and security of our community through their handling of incidents across the county. These range from a massive response to what ended up being a swatting incident at Yorktown High School, to the crash involving the Four Courts restaurant, which involved several life-saving efforts from our public safety personnel, to an incident where our officers were pursuing a subject who clearly represented a danger to our community while the subject fired shots at our officers several times. This incident concluded with the subject being taken into custody without injury based on the courageous and professional work of our members in collaboration with officers from Fairfax County Police and Virginia State Police. So, next slide, please. This slide depicts the budget changes that are proposed for this year. So to put them in categories, our personnel increases are primarily salary and benefit driven with some bonuses and one-time funding for our recruitment efforts. The non-personnel expense increase includes things such funding for our recruitment initiatives, increase in our body-worn camera program spending, and other contractual expenses, and in some increases in the vehicle replacement cost. Revenue increases is primarily based on the projected implementation of a full photo speed problem early in FY24. So our budget next year does include 38.6 unfunded or frozen positions, 36 are police officer positions, and a 10% salary increase for sworn members of the police department, along with other various employee benefits. The body-worn camera expansion, just to go into that just a little bit, that's it's a contractual increase, but it also allows us unlimited third-party storage, which really solves the problems for all of our investigators because the amount of video evidence that we collect at any crime scene now is growing by terabytes. And having a place that we can put it and make sure it's readily accessible for prosecutions, the Commonwealth Attorney, whatever, it's going to be a huge impact there. This additional funding will also increase the license plate reader program, but this time through Axon, and also have a signal that if an officer were to draw his or her sidearm, the body-worn camera would automatically activate. We have one position reduction in this budget. It's a records assistant position. The position's currently vacant, and we don't expect substantial impact, assuming there's not a substantial increase in the number of requests or other staffing challenges. But since it's vacant and has been for some time, we don't anticipate significant impact from that. Next slide, please. So there's six different things on the screen, and three are inward facing and 3 are facing the community. So I'm going to discuss each one of these more in depth, but another area that we spend a considerable amount of our time is planning for the future. You know, we know that the landscape, density and complexity of the county is going to continue to develop and change over the coming months and years. So we pretty regularly have discussions about what do we need to do to be prepared. And, you know, I think I shared with you last year, we sent some folks out to Seattle to learn more about Amazon. And, you know, so we look at our staffing study from 2017 that talked about 405 officers, but honestly, our goal now is to get back to 377 officers. It doesn't mean that we shouldn't be having these conversations and thoughts about future planning, but our goal for right now is to get back to the 377. And we'll continue to focus on that area. Next slide. So this slide gives an overview of our current staffing levels. As I mentioned, our total authorized strength is 377. This year, 376 are funded. As you can see, overall, we're not seeing the numbers move in the direction that we were hoping they would. Functional staffing is probably at our lowest level. Over the last 3 years, we lost 139 officers while only hiring 109, and that's despite all the innovative and hard work done by our recruiting team. You know, but this isn't a problem unique to Arlington. Every time I get together with any other police chief, we talk about two things. It's the staffing challenge and wellness, and you know, everybody is experiencing these challenges. But I do think we're currently at our lowest point. We do have recruits in field training, so hopefully in the next couple of months they'll finish that, and that'll impact our functional staffing number. As you're aware, in 2018 we restructured for a functional staff of 325. Since then we've continued to make structural changes. We've reduced specialty assignments. We're actually holding supervisory positions, and this is all in an effort to make sure that we're meeting our core service obligations to the community and trying to find that balance of having a well workplace and a sustainable balance. The chart on the right on your screen shows where we are with our number of years of service of our current staff members. 35.9% of our sworn officers have less than 5 years of experience. And over the last year alone, we lost 600 years of law enforcement experience. And in the last 2 years, 1,276 years of law enforcement experience. And in the 2.5 years I've sat in this role, I've promoted about 75% of our supervisors. So we have a lot of new ideas. That's good. But one of the things that's important is in 2023, we're going to work to build a leadership training program to help all of us that are sitting in new chairs move through that learning curve as quickly as we can, because there are a lot of us sitting in new chairs, and training is a big part of that. And despite our staffing shortage, we have remained committed to training. Over the last year, our staff participated in just under 80,000 hours of training. That counts all the basic recruit training too, but we do have a very defined internal recurring training for seasoned officers as well. It's after 9/11, it really focused on tactical, and over the last 18 months or so, we have increased our other side of training, all the other skills that are equally important to being successful in this job, and it includes topics such as communication skills, fair and impartial policing, implicit bias. So we've tried to make sure that we're training to all the different things that all of our members need to be successful. Next slide, please. This slide shows departures over the last 3 years. I mean, the chart on the left just shows that, 53 last year, 50 the year before. 6, 7, 8 years ago, the norm for us, it was 24 or 25. So we're having to adapt to a much more robust number of people leaving, which really puts the demands on recruiting people. And the chart on the right is interesting to me because it shows how much time people had when they left. And the chart on the far left, the 2020, I think is more representative of what is normal. We see people at the early stages of their career leave, and we see retirees. That middle chart for 2021, there's 24 people that left between 5 and 24 years of service. That's hard when you lose that kind of experience, and that's not the norm. As you can see, last year, the numbers in the middle have decreased, but it's still 20, but I'm choosing to see that as positive. We're moving in the right direction. Last year, I shared with you that the number of people that resigned from the police department, 63% of those folks left the profession, which is completely unheard of. And so 2022, that number is down to 38.2%. So still very elevated, but definitely better than 63. Next slide, please. So this is really focused on our recruiting. So we continue to see significantly decreased number of applications. And this, too, is something that's happening to police departments across the profession. But in 2020, we had 1,466 applications, and in 2022, down to 880. And I would suggest that 1466 was actually a fairly low number. So we've tried to be very supportive and innovative in how we do recruiting. And I'm not going to dwell on this a lot because they were here recently with you. But our ambassador program continues to be incredibly important, where we partner with colleges and universities. And it's not just people who are graduating. It's a 2-3 year courtship of trying to get people who want to enter law enforcement to come to this agency. And that's been incredibly effective. But we've added things like increased advertising. There's QR codes on the sides of our cars now. There's a signature block on everybody's email. And we're working with an advertising and marketing company to see how we can even do more and better with that. The other thing that we did, which is important, is we added 2 temporary positions to our recruiting team, and we've tried to streamline all of our processes to include having an electronic system where people apply, they provide all their background information, we stay in touch with them. And we're doing remote testing now because we've got to find ways, when a qualified applicant drops into the pool in the region, everybody wants to be the first one to them, and I want us to be the first one to them. One thing I think it's important to share in this part of the conversation is we do track our hires. Usually we look at the last 100 hires, but this time we look back to 2018, and we're seeing consistently the diversity of our new officer classes has continued to increase over those years, so that's very positive. Next slide. This slide focuses on how we compare to other jurisdictions. Now, granted, this is salaries as they start today. Okay. And I've talked about the staffing challenges aren't unique to the police department, but we're in a time now where I think we're going to see every police department constantly juggling to try to move up that scale. And I think that's going to be what we're going to see over the next couple of years. One thing I would point out on that is that our starting salary will increase to $66,374 on July 1st. I just don't know what the other agencies are going to do. Another thing that we look at, and we recently polled to make sure we had current information, is vacancy rates. So we looked at the 13 agencies around the region, and the average vacancy rate was 12.4%, and unfortunately ours is currently at 17.5, which is the second highest. So, I'm hoping to see that number come down this year, but it is definitely elevated. So for me, the question was, okay, what do we do about this? And I think there's two parts to this challenge, and the first is keeping the existing staff that we have. Losing 600 years of experience a year is tough. And the second part is, how do we recruit people into the profession, and how do we recruit them to Arlington Police? So, I think it's a multi-pronged strategy. The first is pay and compensation. That's always going to be a part of the conversation, and steps have certainly been taken here, but I think we're in this phase where every police department's going to be trying to jump each other over the coming years. So, that'll be a part of the conversation in years to come as well. But equally important is internal opportunities. What are we doing to make this a police department people want to work at, and importantly stay at when they get here? So despite our staffing details, we've continued to have temporary details to try to create opportunity for people. Nobody wants to feel stuck in their job. So we try to find opportunities to allow officers to go experience a different kind of police work for, it might be a week, it might be a month, but having an opportunity to do something different is important, and we've continued to prioritize that. Some of the other things that I think are very beneficial that are inside the police department is the expansion of our take-home car program, our patrol schedule, coupled with the new 37.5-hour work week, our wellness initiatives, and the proposed 4-year drop is also very positive. I've talked to several people who are in that 3 to 4, and many of them, nobody's told me they're leaving yet, so I'm hoping they all stay. Next slide, please. One thing I wanted to touch on is the service reductions that we announced last year. Our top priority remains the safety of the Arlington community and maintaining the ability to respond to all of our core services. And we're trying to do this with having a reasonable work-life balance for our staff. So last year in the spring, we announced service reductions, and this is after we had done all the internal structure changes that we could find to do. And I wanted just to be clear what those were. We did reduce some investigative priority, and these are typically crimes against property and often crimes that have very little solvability factors. So that is a part of the conversation. And we did change our posture on some response to calls for service. But this is the part that it's important to me that it's clear, is that it's really for calls that don't require a police officer to be there. So if I go out of my house in the morning and the flower pot got beat up overnight, and there's really nothing to do, that report can be filed online, and it's still a police report, it's still in the system, it allows us to track crime data, but at the same time, it allows that officer to stay in the community and focus on other issues. And that's what much of that service change really amounted to, because we want to keep our officers available for the more significant things that do occur. The slide will show that one of the ways that we've tried to make sure we are ready to live up to all of our core services is we've reprioritized overtime throughout the police department. So we looked at all the different types of overtime that officers work, and we've made a list of the ones that are critical to our success and our core services. And every month when overtime is filled, those have to fill to 100% before any other overtime is available. And these are the things that help us meet minimum staffing, help us be prepared for the mental health calls for service, deal with Clarendon. So we've asked a lot of our officers to work extra. And just looking at the prioritized details to meet our minimum numbers, it's a little over 25,000 hours throughout calendar year 2022. And last year, when I met with you, I shared that, our overtime in general, our office, each functional officer worked about 7 weeks of overtime on average. That number's unfortunately gone to 9. So what we're doing now to meet our core services, I do feel is working. You know, we are making sure that we always have staff. We're in a state of readiness. We can respond to whatever occurs. My concern is that in the long term, that may not be long-term sustainable. But for now, I do think it's working, and we are prioritizing the safety of the community through these core services. Next slide, please. So now I'm going to switch to talk about crime. So unfortunately, you'll see that both crimes against persons and crimes against property are predicted to be up in 2022. The official numbers don't close for 2 weeks, so it may change a little, but it's not going to change dramatically. Crimes against persons up 16.3%, and the primary drivers, and this was the same conversation from last year, was the things really pushing that number up are both aggravated assault and simple assault. So we are seeing more incidents that are involving weapons, and that would push an assault into the aggravated assault category. And, you know, we looked at these on a heat map, and it's traditionally in, you know, the metro corridors, the mall, the places where there's a lot of people, Clarendon. And we also look at domestics to see if there's a shift in the number of domestics. And domestics have stayed relatively consistent, so they're not a part of the driver of the increase, but it's really those two crime categories that are pushing that number up for 2022. Crimes against property increased by about 23%. While burglaries are down, we are seeing, you know, a significant number of larcenies going up, and that includes larcenies of and from vehicles. So my plug that I meet in every meeting is I would ask everybody to lock their cars, do the 9 p.m. routine, because a lot of the cars that we're seeing victimized are found unlocked, and or the keys might be in them. The larceny category is up significantly. It's up by like 768 incidents last year. And, you know, part of this, I don't have any data for this, but I do think that our push to online reporting and asking people to do things online, I think we are having some crimes reported that maybe weren't traditionally reported. And I think that's a good thing, because it gives us the opportunity to track where things are occurring to make sure that we're being smart in our deployment. So, you know, like I said, I don't have data to support that, but I just feel like that's part of this conversation. The final category I want to touch on are firearms. We're seeing a trend there that is I definitely don't like, in that last year our officers seized 147 guns that were used in crimes across the county, compared to 126 the year before and 104 the year before that. So we're definitely encountering more guns than what's been normal. Next slide, please. The next slide is about the opioid crisis. I mean, this is affecting every part of every community across the country, and I think it is a whole of community effort here to try to make impacts. For Arlington, the total incidence involving opioids remains near the highest levels that we've seen since we began tracking in 2017. The total number of opioid overdoses increased last year, but fortunately the number of fatalities associated has decreased, but we still lost 17 lives in the community. So, and in 2023, we've had 37 incidents so far with 5 fatalities. So there's much work to be done here. I mean, the interdiction of drugs into our community and identifying those selling this poison in our community is and will remain the #1 priority of our organized crime section. That's where they spend all of their time, is focusing on who's importing and who's selling this stuff in the community. We also participate in the Arlington Addiction Recovery Initiative, which is a task force that includes multiple stakeholders who work on prevention strategies, treatment options, and supply reduction. And every time there's a fatality now, we do 2 investigations. We do the death investigation, but we have a intense, expanded investigation into where that drugs came, who sold the drugs, where'd they come from, and to try to get as high up that distribution chain as we can. I've shared with you before that we deployed Narcan to our staff in 2019, and since 2019, our officers have used Narcan 85 times in the community, and 21 of those were last year, 12 so far in in calendar year 23. So it is a life-saving tool, there's no question. Next slide, please. I want to touch on wellness very briefly. I know you're aware that the Cummings Foundation has been very generous and provided a lot of resources to the police department over the last couple of years, but I thought it was important to share with you what that's turned out to be. You know, the Cummings Foundation is represented locally by Dr. Dave Baker, and over the last couple of years, they've donated direct service is somewhere in the vicinity of about $500,000 to the police department. It includes things such as fitness trainer, nutritionist, health coaches, health fairs. And the goal here is to develop a program that is data-based to show what works and what doesn't. So it benefits our public safety, but it can also benefit police departments everywhere once it's data supported and data backed. We had the health screenings, which after 1 year did show positive impacts in a whole lot of categories, so very excited about that. Final slide. Our final slide focuses on our equity, and this for us this year is really focused on our engagement. And it's getting beyond, I think we've done a good job over the years of partnering with civ feds and community groups and organized groups, but where I think we needed to expand and really focus is on how do we get beyond those groups? How do we get to where everybody is who wants to have a conversation with us so that we can have the open and honest dialogue? We've had several new events, several things to try to encourage these relationships, and we're going to continue to move that forward because we're seeing a lot of positive impact and a lot of positive feedback. And that's one of the reasons I wanted to share some of our work on the conversation with the chief suggestion is it's not just empty conversation. We do listen and we follow up on it. And with that, I'm happy to answer your questions.
Thank you, Chief Penn. Before we get to that, we were fortunate to have our Fiscal Affairs Advisory Commission do a review at the police department. They provided their written report, but we do have FACT Chair Peter Robertson here to orient us verbally to their deliberations. Welcome.
Thank you, Mr. Chairman, and members of the board for allowing FACT to meet with you again to share with you some of the work that we've done. We really appreciate how accessible and open Arlington County Police Department was with the subgroup that reviewed their budget. It's a tremendous group of people. Our first recommendation, which was unanimously adopted, was that the county board ought to adopt the county manager's proposed budget. But we added to that given the vast changes in laws and policing procedures and online reporting, the pandemic and other things, that we hope that you would find a way to include funding in the FY 2024 budget to update the 2017 study on the appropriate levels of authorized positions. We thought that information would be helpful both just for transparency purposes, but for budgeting purposes as well, regardless of whether additional funding was ultimately provided in response to the results of the study. And I'll note that FAC isn't the only entity that's opined along those lines. The police department's overtime audit from May of 2019 endorsed the concept of ACPD periodically updating their minimum staffing calculations. Our second recommendation, which was also adopted unanimously, is we endorse the objectives that the chief laid out when he spoke with our sub-team, providing excellent leadership, efficiently and effectively delivering critical services, policing with the community, not just for the community, recruitment and retention, wellness of the officers, and accountability. But our review of the budget document led us to believe that ACPD could provide some additional data that would help everyone determine if those objectives were being consistently met. We included in our recommendation some of the kinds of data that we think that the board should ask for so that we can all try to judge if those objectives are being met. And of course, this recommendation is sort of the first cousin to the performance measures a discussion that we have with you every single time we come before you. We think that ACPD, like every other department we've reviewed, can improve some of their performance measures, but this is just about providing some additional information that could help inform all of our thinking about whether those laudable objectives are being met. Quickly, future considerations. FAC welcomes the increased funding for compensation and benefits based on the arbitration awards and tentative agreements negotiated with the Arlington Coalition of Police. We similarly welcome the efforts to hire more wellness professionals. We know the department wants certified professionals in those positions, and that recruiting and retaining those people is every bit as difficult as recruiting and retaining line officers. We support the department's expanded efforts to grow a talent pipeline from local residents, such as the cadet program that focuses on college students, a terrific supplement to existing recruiting efforts. We note that the department is using a very effective software to achieve fast background checks. And as we talked about this, we wondered whether that experience might in some way be shared with other departments in the county. In making, for example, the one that came up most easily was whether Arlington Public Schools could use it to help screen teachers and substitutes. In raising this future consideration, we recognize first that the software is very expensive and that the interface would be different for every user, which might make sharing this software somewhat difficult. Finally, we note that the development of the 2025 budget would benefit from the completion of an annual report prior to starting the budget cycle so that we have the latest data reflected on in the budget proposal itself. Again, thank you for this opportunity. I'll hang around in case you have any questions.
Thanks so much, Mr. Robertson, and please extend our thanks to Ms. Noakes and Ms. Askey for their review and for this presentation. Couple of things that you've identified for future considerations that I want to touch on, so stick around. Thank you. Colleagues, the discussion is with us. Ms. Crystal is at the ready with a question, please.
Thank you so much for the presentation.
Sure.
And unsurprisingly, want to jump in and maybe dig a little bit into the attrition and issues we're experiencing there, which I know has been your top priority. Looking, for example, at slide 7, I think this echoes something we've been talking about with you and with representatives of the employees, is that the sort of worry of the hollowing out of those folks mid-career and how we're seeing kind of an increasing amount of attrition. I wondered, I thought it was sort of an interesting observation you shared that everyone, of course, is contending with vacancy rates because of the troubles recruiting, but that ours is a little higher. And I wonder to what extent, either because you've seen their data or just from anecdotal conversations, this kind of increasing loss in the middle is common across the region. You mentioned, for example, that I think you said that 63% of those who left the profession, which is resonant with, I think, what we've all been hearing. But that does mean, somewhere like 37% stayed within the profession. And so do we have is there a sense, comparing to other jurisdictions surrounding us here in the DMV, that we are, losing our mid-career people to other jurisdictions, or other jurisdictions doing a better job of retaining? And if so, is that something we ought to be considering because it has to do with the pay scale, et cetera? Or is this, it's just a really challenging time to be a police officer, and that's affecting kind of those right in the middle of their careers as much as anyone?
So I don't have any data to support my answer. I think that 2021, some of that was we lost some folks to Amazon. That was sort of that time frame. But I think the answer lies in that just, I think that chart where the two edges go up, that's sort of what is normal. You retired or you decided I'm going to move on to the federal government, or I'm going to make a change. So to still have 20 over last year, I don't have a good answer for that yet. I'm going to need to wait and see. But I think it is, a lot of it comes down to its challenge. It's a challenging time. It is. And I think that's why when I talk about the priority, it's to keep the folks that we have and not lose 600 years of experience, at the same time focusing on recruiting. So, I think that it's a combination of efforts that's going to lead to the success there.
All right. Thanks, Chief.
Thank you. Ms. Garvey.
Yeah, thank you. Have we worked at all or thought at all, and perhaps it's just not going to work, about having a program to take over student loan debt for our officers? When I talk with our officers, they seem to feel that their student loan debt is a huge thing, and I know the interest rates are really high. Have we had any discussion on that? And maybe it's just impossible, but
I don't think we've had discussion to the point of action yet, but I think we have definitely had discussions about it, because it is one of the things that we do here. And I know there's been, numerous discussions, and I think there needs to be some more pointed discussions on that topic. I think it is, when we look at the different things folks are offering, some are doing housing allowances, some are doing 5% for college, 5% for military experience, shoe allowances. So there's a lot of different things that are in the conversation, and it's a matter of finding what's right for Arlington.
Right. Thank you. Because I think those loans are at a very high interest rate. To me, it's a racket when I learn about it, which we could possibly take, and still they'd pay it back. It just wouldn't be at that same high rate, which might be helpful. So anyway, I'd be interested. Maybe we could even use one-time money to do it. Thank you.
Okay, thank you, Mr. DeFerranti.
Thank you, Mr. Chair, and thank you, Chief, for the presentation. I'm I want to pick up a little bit on facts, second recommendation, and slide 11, which is on, all this is about crime, and crimes against property. I'm mindful that we're having a car airbags, and I think, I'm not sure the precise percentage, but it's not insignificant, the number of crimes against property that may be linked to unlocked doors to cars. And so concerned about that, but the 9 o'clock solution of checking to make sure, I'm curious about if you have a sense of crimes against persons and how we stand by comparison with the region. And I'm aware of sort of the elements of an assault, but, it's very helpful to understand aggravated assaults may be up because a weapon is there. That is very concerning, obviously. But do you have any sense as to how we compare to the region, and thoughts on why we're up on crime? I'm not asking that from I'm terrified. I think we're a safe community. I'm asking that from do you have a sense of a little bit as to what is leading to the increase and how we stand?
Sure, I'm sorry. Our analysts looked at that, and, crime is not just up in Arlington. It's up across the region, probably much across the country. And when we look at our crime statistics compared to others, I don't think ours has leaped any higher than anybody else. And I think it's important, and I'll share a little bit in numbers, because I don't love talking in percentages. So the total increase, hang on, let me get this right. I meant to say this when I was going through it. The 16.3% increase represents 273 incidents. So I think it's important to share the number with it, because percentages can be deceiving. And the 23% increase is 1,372 incidents total, additional. I'm not minimizing those numbers, but I think it's important to talk about numbers sometimes and not percentages. But I don't think we're seeing anything that's inconsistent with the region here at all. And I think some of the things you mentioned, like the airbags and the wheels and thefts, wheels and tires, these are very much things that are happening throughout the region. So, we spend all of our effort on those investigations in a regional conversation. The simple, somebody walks down the street and tries doorknobs and finds an open car and takes $5, that's not necessarily more organized. But some of the catalytic converters, the wheels and tires, that's different. So we approach them differently depending on what it is. And one of the big drivers in that 1,300 number was larceny, 768, general larceny. So a lot of that's going to be shoplifting. And that's where I think that I think that there is some increase in reporting because of our change in posture and the pushing the online reporting, but it's nothing more than a thought at this point.
Well, and this is also a post-pandemic year when there was a lot of return to pre-pandemic activity, and these are year-over-year data I can certainly share with you, Mr. DeFerranti. We look at annually the region through the Council of Governments, and I can't remember where we stood in the various items, but there was nothing that stood out to me as Arlington experiencing something that everybody else wasn't going through as well.
No, not at all, and that's why it was important to be this. I still believe this to be a very safe community, but we are seeing some change in our crime.
Mr. Karantonis.
Thank you, Mr. Chair. I also remember this statistics from COG, and indeed the increase in car thefts, etc., is pretty much a trend regionally. We are not special in this, unfortunately. So I wanted to go back to your slide 7, the departures, and kind of follow up on Ms. Crystal's remarks. So it seems to me that the green bars, the 0 to 5, the new recruits, it seems that, 1 out of 6, 1 out of 7 really decides to leave the department once, soon after they have joined the service. So is there any special, or is there any measure that we can introduce? We even talked about, the flexible benefits packages, et cetera, that could motivate these servicemen and women to stay, to have, to reduce these bars, to reduce their proclivity to depart?
So I'll share my thoughts, and this is the section that Chief Cassidy oversees, so I'll go to him second. But I think that we've experienced over the last 18 months some people leaving like before they go to the academy or early in the academy, and that's not the norm for us. So I think we're finding people learning a little bit more about what they thought they wanted to do and deciding that they don't want to do it. And I think that's part of the conversation. We have lost, I think last year, out of that 24 number, 13 were before people completed field training. So, but that's not always that they weren't going to succeed. I can remember a case where the person was doing just fine and just realized they didn't want to do it anymore. So it's a very different time, and we're experiencing some things we've not experienced before.
So to understand it correctly, a part of these high departure numbers at the very first bracket of professional experience from 0 to 5 years is also attributable to the fact that some people come in, but they figure out that this is not the profession they want to be in, and then they leave the profession, not only...
I think that's part of the conversation. Yeah. I don't think it answers the whole answer, but I do think it's part of it. If somebody leaves before they finish the police academy, I mean, some people leave and go to a different academy. That's different. But then we've had a few, and it's not the majority, it's very much the small number who just would stick around for a month and then it just wasn't working for them. I don't want to say that's a lot of what we'd experienced, but we have experienced, and it's different. Is there anything you wanted to add to that?
Now, I'll just add that, as Chief Penn said, 13 of those 24 left before they even went to solo patrol. And the majority of those 13 people were doing fine in field training and just chose to leave for another profession or due to other circumstances. We do conduct exit interviews. We are looking at making changes or how we can maybe be more efficient, or do we need to make any changes to those interviews to capture exactly why people are leaving and where they're going. But as Chief Penn said, it's very unusual to see people doing okay, doing well in training, who just all of a sudden, before they even get on their own, decide, it's not for me, I'm gonna leave the department.
Thank you. That makes me understand these numbers significantly better, I have to say.
If they don't share it willingly, would you know if they took another law enforcement job because they got paid a lot of money? Because I presume they wouldn't want to tell you that for fear of burning the bridge in case they ever wanted to have an opportunity here.
We would know. If it's another law enforcement agency, they're going to reach out to our human resources and our OPR.
Okay.
So we would know.
Okay. Okay. Thank you. So my question before we go to Ms. Garvey and Mr. DeFranti again, I really applaud the fact for looking at a programmatic solution during their fiscal review, and that is the investments in a pipeline. I want to be very clear, because everything that we say in public is magnified. I very much support the increases that the board has made, that you have helped develop in terms of increasing pay and benefits and other opportunities, all necessary to ensure that these are good quality jobs that are allowing people to earn what they deserve, and we have more to go. But that's not the entire problem. It's clear that it's not the entire problem with the data that you are providing. And so for me, that leads to pipeline and making investments that are not going to pay off in the next couple of years, but in the next 10 perhaps. And so I know that in DC, they've had this junior police academy kind of thing that's a lot more robust than what you described. So I was just wondering about whether you had any sense of whether, a week here, a week there is enough. I think they do like a 6-week program for 14 to 17-year-olds, and kind of like a big deal. And it seems like that makes a lot of sense if your true goal is to develop a pipeline of people who might not only choose the profession, but choose you.
So I agree with you. I think that a week's not going to do it, but what we're thinking is the week is enough to really develop the interest. And if we start the cadet program, that's an opportunity for the person to have official roles with us. And it's not a week or here, it's ongoing. I mean, the goal really is to get, if they're interested in law enforcement and here in Arlington, is to tie them to the agency where they have a role ongoing all the way through 2 years or 4 years of college so that they don't completely break from us. And that's what the idea of the cadet program is creating a way that we have a sustainable and ongoing interaction, and that person reports so many hours a week. I mean, it's not defined yet, so I'm sort of making some of that up as I go. But, I think cadet program is what you're talking about, and it's the same thing we're talking about.
It's even earlier. So 14 to 17-year-olds, before they're even linked to college. I think the cadet program sounds terrific. I'm encouraging you to look at even earlier opportunities. When you start to, 14 is when a lot of kids start thinking about career. And if you can hook them on a career in law enforcement and they can do it in their own home community, perhaps that just increases the likelihood that they will be there at some point later.
Yeah, we had a program that was called the Explorer Program many years ago, and unfortunately, it didn't last. It wasn't sustained. So, I get what you're saying, and I think it complements the cadet idea. It's just age brackets.
For sure. Okay, Ms. Garvey.
Yeah, continuing on the same theme, which seems to be the most important with attracting and retaining, a couple of other ideas which you probably already thought of or are looking at. The military, because we have so many people here with the military that retire. I assume that that's where we often get police officers. And then retirees who might want to come back and work part-time sometimes, maybe we do that?
We hired 3 retirees a couple of months ago.
Oh, good.
We're actively pushing out to our retirees that either want to come back full-time or in a part-time capacity to help with different open positions that we have. We do recruit very actively with the military. We're V3 certified, which basically gives us some extra access to people as they're out processing. So we are very engaged with military folks as they're departing. But we are looking at retirees in ways that if people that want to continue to serve can come back and do that. And we have 3 officers who came back and they're now working full-time.
That's great. Yeah, I think often it's a very intense job, and I can see where you need a break. But once you've been away from it, you might want to come back. So that's good to hear. Mm-hmm. Thank you. Yep.
Mr. DeFranchi.
Thank you, Mr. Chair. I just wanted to briefly appreciate the Cummings Foundation work, and I want to see if I can follow up offline afterwards, just to think about wellness, because that wellness could be exacerbated by the tension of having fewer officers, and I just want to see if I can follow up afterwards. Thanks, Chief.
Happy to.
Thank you. All right. All of our lights are off, so Chief, thank you very much. We very much appreciate this opportunity. We've spent a lot of time with you over the last few weeks, but we always welcome it. And good luck. Go forth.
Yeah, good luck.
Thank you.
All right. Get ready for our set change and invite up next Director Flagler in the Department of Public Safety, Communications, and Emergency Management.
Yeah, it's been a fun weekend, right?
11 weeks, wow.
Director Flagler.
Oh, thank you, Mr. Manager. Good afternoon, County Board. I'm honored to be here with you this afternoon on behalf of the County Manager and my colleagues in Public Safety to present DIPSM's FY24 proposed budget. As I said, my name is William Flagler, and I'm excited to present here today with my team. So let me take a minute to introduce these individuals to you. We'll start with Jacob Sauer, the Emergency Communications Center Administrator. Then we have Jeff Bergen, our Chief Financial Officer. Hannah Wynot, our Public Affairs Manager, is up in the virtual world. And then we have Heather Geldar, our Integrated Programs Manager. In addition to the team you see here today, we're all supported by a phenomenal staff who work tirelessly in the areas of emergency communications and emergency management, providing services to the community and to public safety partners around the clock. I would like to also mention it is Emergency Management Professionals Week, and I would like to extend my gratitude to all those who are emergency management professionals in my department and in other agencies. When we talk about the program, services, and accomplishments today, those things would not be possible without their amazing contributions, so I just wanted to take a minute to thank them. And my last thank you is to Mark and Dr. Miller for their support and their leadership over the last year. The FY24 budget comes at an opportune time for DIPSM as we prepared for this budget process. DIPSM undertook a strategic planning process to reevaluate our mission, goals, and objectives for the next few years. We felt the timing was perfect to do this, as much had changed for our department during the multi-year COVID emergency response activation. Most of that change, we soon realized, came from demands from the community. Our mission has not changed across all our programs. We're committed to coordinated emergency preparedness and response capabilities, resources, and providing outreach to the community. Our mission spans divisions. We are unified in this. We are trying to do this in a way that is agile, responsive, and equitable. This will allow us to best serve the Arlington community by supporting residents and first responders when they are most in need. We see this when we're receiving calls from the community in the Emergency Communications Center, analyzing data and information in the watch office, providing training to volunteers and community groups on what to do until the help arrives, and working with partners, internal and external, to the county on emerging incidents. In each of these instances, we do so with the community and our customers in mind. Next slide, please. In DIPSM, we have 3 lines of business that you can see here to deliver our services. They're very simple: our Emergency Management Division, Emergency Communications, or 911, and our Integrated Programs Division, which provides services that cut across those divisions. These seem direct on the surface, but can mean different things to the customers that we serve. This has allowed us to take a look at the impact. In doing so, we have found what they look for from us in terms of our programs and our services. As a result, we have really focused on 3 ways we can deliver on our mission to the public. Today, we want to talk about how the programs and the services you read about in the budget book provide an impact to the public in these areas. Next slide, please. So the first thing we want to talk about is building a more ready and informed public. This cuts across some of our core programs, specifically community engagement, preparedness planning, and public safety communications. Being ready and informed as a public required us to be able to deliver programs and services how you need it, where you need it, and when you need it. This has been the biggest evolution for us. In the past, we were more the coordinators of those services, but we have seen a shift in the last few years. As you can see, some of the things that we're doing here, and I'll highlight the First 15, which is a new initiative. The First 15 combines Until Help Arrives, emergency preparedness, and 911 education curriculum to empower residents to help themselves and others in life-threatening emergencies like mass shootings. DIPSM brings the class to community institutions rather than asking residents to come to us. We're currently delivering the program to staff and congregants at houses of worship, then plan to expand to nightlife institutions and affordable housing units. And another one here is the Community Advancing Resilience and Readiness Together, also known as CART, the county manager appointed committee that brings together community leaders to identify barriers to and to solutions for building resilience to the community. DIPSM has provided staff to support this wonderful group, none of which would be possible without growing our team. The next thing we talk about here is 911 engagement. We've started to see that 911 preparedness is community preparedness, and community preparedness is public safety preparedness. As the point of intake, 911 plays a major role in the community's ability to be resilient. Countless examples of 911 professionals receiving calls that led to a public safety response and were seeing something and saying something help mitigate a larger emergency. And then finally, we have Until Help Arrives, which has become one of the biggest names in our training catalog. And as a result, we have found more diverse ways to deliver the training. We have YouTube recordings to watch on demand, virtual classes, as well as video shorts on educational series with Arlington TV. Those courses are usually associated with first responders, as they are the help that arrives, but we have been seeing a larger role in the teaching of that to the public. This is helpful to both DIPSM and the public, as we can talk about what they can do, but also what information is helpful to our services such as 911 and emergency management, as we are the first point of intake. We have delivered a 200% increase in those class offerings to meet the rising demand. And resiliency. Resiliency is hard to measure. We've tried and don't have the perfect metric to show how much we are prepared. If you see our metrics, we pull from things like our outreach to vulnerable populations, our ability to train and exercise on core capabilities, and our call answer rate in the Emergency Communications Center. We will talk more about these to show the work behind the metric. Next slide. It is 2023, so saying embracing technology may sound a little old school or that we are Luddites. So forgive us and remember we are an evolving group. It is more than just us using tech or implementing it. It is having the tools to do some of the legwork and serve as a force multiplier for our programs and services when we and our partners cannot be there. Some of our largest investments in capital and general fund dollars over the last few years is in technology to improve services. Our next-gen capable 911 phone system enables us to have GPS caller location, text and video capability. A few years ago, we sat here talking about the time it took for 911 professionals to locate the callers for abandoned calls. Our technology has cut that time. Imagine where we will be in 2 to 3 more years as the technology continues to evolve. Same with situational awareness. We opened the watch desk about 8 years ago. It was mostly a 911 function to assist with weather alerts. Now it harnesses data across social media platforms and presents a common operating picture to partners. We are on the precipice of new situational awareness center that will further advance the ability to take information in real time and present it to first responders to mitigate disaster, improve response, and foster resiliency. In terms of engagement, we talked about our classes, but the tools we have now allow us to design and deliver more tailored engagement to those who need it the most. And lastly, we are proud of our Arlington Alert metrics. 15% of the population and 100% of our employees are registered for Arlington Alert as a place to get timely information, but we know we have to amplify our message to other platforms. We've seen 140% growth in our social media following, and our social media platforms are where people come after a major incident. We are able to do this by promoting our social media pages as well as our Arlington Alert capability. Harnessing these tools are so critical, it just makes us more excited for what the future holds. Next slide. Resiliency and emergency management go together, as you can imagine, and emergency management is nothing without our partners. This one area probably encompasses the most of our programming, is more of the traditional work you think of when you think of 911 and emergency management. This work is done by our preparedness team, operations, and logistics, our 911 systems and administration team in integrated programs. Partnerships, systems, and education are critical to the work we do. But even though this is our bread and butter, we are seeing new ways to approach this and a continued expansion of what we call resilience. FEMA has a national preparedness goal, and in that, there are 32 capabilities for jurisdictions to strive to meet. They focus on prevention, protection, mitigation, response, and recovery. Don't worry, we won't go through all 32 right now. What we have focused on with our preparedness team is making sure our trainings, exercises, and planning focus on these each year, and we continue to build out our core capabilities. We are currently about 75% of these, but they are not a box we check and move on. We keep drilling, keep planning, keep building our partnerships to deliver. We have worked on response capabilities through symposiums with Arlington Public Schools. We have continued to focus on continuity of operations and planning, drills and exercises. We've partnered with the Department of Technology Services on cybersecurity, threats, and preparedness. We continue to work with our public safety partners on drill alerts and warnings as well. Our resiliency is also enhanced by the systems we have in place. We have always focused on regional collaboration, and that has been a bedrock of our emergency management and emergency communications. But now those partnerships are looking at shared threats and risks. That is done by our regional collaboration and our own leadership on those regional committees and councils. We have staff sitting in leadership roles on the Regional Emergency Support Committee at the Council of Governments, the 911 COG Committee. We have staff serving as chairs at COG for Regional Preparedness Program, the Public Communications Regional Support Committee, as well as the FEMA Region 3 FEMA Cost Recovery Committee. So as you can see, we are well represented across the region and the country and are actively engaged. We mentioned cybersecurity earlier. Well, our investments in new systems in the ECC have been done regionally and look at having redundant systems that can withstand cyber attacks that know no jurisdictional border. Our radio systems continue to look to boost security and interoperability to provide seamless communications. These investments and solutions do not happen in a vacuum, but are the product of partnerships and systems thinking. Systems are not just technological. We saw our last EOC, in our last EOC activation, just how strong our relationships were across departments and across jurisdictions, and how critical that was to getting things done and resources ordered. Those relationships continue, and staff are working towards that systems approach with a unique thing called the EOC Exchange Program, where if another jurisdiction needs one of my staff members in an activation, we can send them and vice versa. Lastly, resiliency starts with education. That is why we are starting to teach 911 in schools, as I believe it is important to learn how to engage with 911 at a young age. Like we all learned, stop, drop, and roll related to personal fire safety. Also, as we saw with the 2019 flood, small business outreach is also critical. It is not just about being prepared, but about more specific items too. Insurance, individual assistance, small business assistance. We keep doing more and keep expanding the definition of how we can be more resilient. Next slide, please. And here, 911 is really focused on equity. And one of the things in 911 is we don't know who is going to call. We don't know many things about the caller, but we do know is that if they're calling 911, they need help. And it is our job to provide that in an equitable manner. And you can see some of the items displayed on this slide highlight some of the efforts that have been put in place to ensure equity. Next slide. We talked about equity in the sense of providing services for all, and you can see that the volume of services that we do provide. We saw a dip in FY21 actuals due to the pandemic and changes in response protocols, as well as community shutdowns. Positively, we saw a decrease in the number of non-emergency calls, but they still represent around 65% of our total call volume. Call data is a reflection of volume. We are working on metrics of quality too. Our protocols, our ability to provide life-saving medical information to callers, call volume is important. It shows the demand on our 911 professionals, but there is another side too, which is our ability to communicate and provide information to our callers. We look forward to those new metrics in FY24. Next slide. And again, in emergency management, we have talked a lot about these already, but that is just showing how much equity is a part of what we do on a daily basis. Launching the Community Advancing Resiliency and Readiness Together Committee. This is a county manager appointed committee where DIPS again provides staff support. Over the last few years, we've seen more investment in local tax dollars for EM staff away from a more traditional grant model as the focus has become more local in nature. We are seeing this in volunteer management and community engagement, and the payoff has been a more focused, more equitable design in our programs. We're doing more Spanish language training within CERT, or Community Emergency Response Team, and our UHA classes. We're bringing more of our trainings into specific areas, such as houses of worship. Emergency management plans now take into account the unique challenges within the community and developing programs and services to address those challenges, such as affordable housing venues and other areas working with partners in health. On COVID response, we produced health equity reports for over 2 years on how the county was administering COVID vaccines and testing, and we're able to highlight that data with Federal Emergency Management and the Virginia Department of Emergency Management to demonstrate equity. In fact, FEMA cited Arlington's health equity reports as one of the most comprehensive in the region. This did not just show how great we are doing, but helped validate our claims for cost recovery with FEMA. You can see we've hosted 55 plus community engagement events this fiscal year alone, collaborating with over 80 partners. This sort of proactive trust building and robust network means we make a significant community impact, particularly for a department of our size. This is illustrated in accomplishments like delivering over 65,000 COVID-19 tests to our nonprofit partners. Next slide, please. Equity, resilience, information and technology. These are what we covered are at the heart of DIPSM's programming and at the forefront of our budget planning. They reinforce, as the manager noted in his message to the board, that we are a resilient community. We want to make sure to do our part to reinforce that resiliency and do so in a way that meets the principles of financial stability, equity, and efficiency. We feel that our FY24 DIPSM budget does this. Our budget ensures that we are planning for current and future needs. Current budget has remained relatively stable for the last few fiscal years. However, the activities we are pursuing indicate a changing environment. DIPSM is ensuring that this budget reflects the reality of present state, current operations, contract obligations, and the core services, while also pursuing innovative solutions and research. This budget process focused first on staff, as it did for all departments in the compensation packages, but also making sure our programs were staffed to the level to provide the service. Inclusive community engagement is something that we focused on in this process. We've talked about our whole community approach, and it is reflected in our FY24 budget. Our integrated programs division, relatively new to DIPSM, has allowed our community engagement to better encompass 911 and emergency management. This new line of business has brought technology, engagement, and public affairs together. We have grown the team internally, and the results have been increased programming and leveraging the data we discussed earlier. And then again, business process improvement. Internally, staff has done a lot to focus on working smarter and maximizing the resources that are available. This means utilizing new tools to assist with staffing schedules in the ECC to help with overall staffing and coverage. We've leveraged new tools internally to share data and communicate progress on items such as financial cost recovery with FEMA. Next slide. I have provided you with an overview of our programs and our services, and now let me discuss our budget, specifically the dollars and the positions and what is behind those programs, services, and initiatives we are doing. The reality is, as we presented, it is that we are able to do all of that with the sustainment of staff, programs, contracts, and overall funding. Our budget proposal is consistent with some small increases due to contractual demands and some decreases to meet proposed reduction targets. This was our focus, as we mentioned earlier. Our biggest priority, we cannot make cuts that drastically alter our ability to deliver programs. Where we must make changes has to be in areas where we can lean on others as multipliers to assist. Our other focus was we could not make cuts to positions that were filled. We have asked so much of our staff over the last few years, and we are just getting back to being able to deliver on strategic goals. The increase to DIPSM's expenditures was a total of $15,269 out of a $14.6 million budget, which is about a 0.01 increase. In terms of revenue, we are seeing changes in our urban areas security initiative revenue beginning this year and continuing for the next few years based on conversations in the region. This budget is not yet impacted by it, but we know in the future cuts are coming to the programs. We saw a moderate change this year in our programming, and it was offset by other small revenue increases from the Virginia Department of Emergency Management for 911 services. This is how we saw a 5% increase in revenue. No increases or long-term changes, just some changes at the state level. I think our biggest change with the most impact is the reduction in staff. Next slide, please. As you can see here, we have 2 positions or one and a half positions that we put up for reduction. And as we said in our budget priorities, we focus first on maintaining our current staff and our most critical programs, products, and services. Once we factored that in, we knew that we would still have to make cuts in areas that impact the organization. Like we proposed 2 positions that were vacant, where we could potentially spread the work around or hope to become more efficient. The first one is a cut to emergency management and integrated programs, where we had a vacant planning specialist. This position has helped internally with our strategic planning efforts, our performance measures, and other department-wide initiatives. In addition, they also served in our Emergency Operations Center and were a trained member of our command and general staff. So in losing that, we lose some bench depth and some capacity, and we will have to work to kind of train up around that. Next slide. And in the ECC, we proposed a cut to a vacant administrative support position. This was a position where we saw a need for some enhanced support services, but it had been vacant, and we went ahead with a proposed reduction rather than fill this to meet those needs. Some of the tasks this position was to undertake would have addressed some of the issues we have found in the center in terms of in-person administrative support, such as facility management, office support, and other day-to-day activities. Next slide. And finally here, you can see some of the key budget considerations that we had. Again, focus on building a more ready, informed public, embracing technology and its role in service delivery, and expanding the definition of resilience. So that is it for me, and I will open the floor for questions.
Thank you very much, Director Flagler. We appreciate it. Colleagues, the floor is ours. Ms. Garvey, I see you looking to get in.
Yeah,
Please.
thank you. Thank you for all of that. You might want to get a drink of water. That was a lot. I'm really delighted to see the sort of emphasis on preparing our public and using I think leveraging our public is really important, not only for preparing them, but, you know, obviously with our response. And maybe in the future, we thought much of kind of gamifying public awareness. I think I've talked to you, I know I've talked to Dr. Miller about the disaster relief trials, you know, with the bike thing. And we did that once before the pandemic. It was kind of fun. But they're tabletops, simple tabletops that are just, you know, quickly done, all of which you could bring in different people that seem like it would be fun and prepare people. I find myself just always thinking that someday these might not work, the devices might not work, and most people just panic when they don't have their phones. So it's probably important to have people try things without the phones and learning how to read a map. I mean, there's just some basic things that maybe you can kind of gamify. So I just invite you to talk about that a little bit, because it seems a little bit like the direction you're going with all of the different groups you have, which are great.
So one of the things after COVID was we analyzed how people do things now, and it changed. So one of the things that we are looking at are how can we partner with people to be innovative, to do things like you said. The disaster relief trials wouldn't work right now because there's still a challenge with people getting together and doing certain things. But we are looking at different ways to do exactly what you are suggesting. So, yes.
Thank you.
Thank you. And if I could channel our friends at FAC for a moment, over the next year, I would just love it if we could start to begin to think about how to interpret some of the performance measures that your department reports on. You know, at this point, like, I don't even know how to really interpret the number of calls and, you know, to really see whether or not it's good, bad, restructured properly, not properly. I would just really benefit from some benchmarks, you know, maybe from other jurisdictions, if there's some industry practices, just to know how we should interpret what we're seeing. You know, for me in isolation, when I think about however many 1,000 emergency calls a day, like that's like 250 some odd emergency calls today, a day. That sounds like a lot to me. I don't know that it is. I don't know what to measure it against. Like, do people look at population? Do they look at urbanized, suburbanized? Just help us figure it out. You don't have to tell me all today, but if you can start the conversation, that's great too.
We'll do that.
Thanks. Mr. Carantonis.
Oh, just very briefly, very in the same vein of thinking. So, for example, the uptake on the Arlington Alert app is kind of stagnant. You mentioned that, and I like the app a lot. So one begins to wonder, is it a good uptake? Is it worth continuing this way? Should we look for different channels?
So one of the things that we noted in there is it's social media is overtaking a lot of your traditional alert systems. So we're seeing increases in both because we've changed the way that we promote. We promote them both. Some people don't want to go through the registration process of Arlington Alert. You have to go to a computer, you have to enter some stuff, versus if you have a social media platform, you can just follow us. And you still get the information, because one of the things that we do through our watch desk is we have a separate feed that is direct. So if you get an Arlington Alert, you get the same message on Twitter. So we're still doing that, and we're still working to make sure that our messages are multiplied through different media channels. So when we send out a message, the media gets it, and they have no problem sending it out without us asking. So there's different ways that the message is still getting out, and we're still going to work to increase that number.
Thank you. The importance of that is because we have seen in recent incidents in APS schools, et cetera, how important it was to, yes, to diversify the delivery channels, but at the same time, I think that people begin to expect alerts in a certain place, and that doesn't seem to be Arlington Alert as an app. So that's just a thought from myself. Thank you.
Yes, thank you. Mr. DeFerranti. Oh, follow-up, Ms.
Just
Garvey?
quick follow-up. I assume we have reverse 911 so that in a major emergency, even if people haven't signed up, we can send messages out to their phones.
That is called a WIA. So we can send an alert where you're not even signed up. I think Silver Alert, Amber Alert, we can actually do that from our watch desk, and you don't have to be signed up.
Yeah.
And the last time we used it was during COVID, when we sent out an alert to let everybody know about the governor's orders to stay home in relation to COVID. So we can do that.
Yeah, no, that's great, which helps make up for the lack of signups.
Thank you. Mr. DeFerranti.
Thank you so much for the work. I'm mindful of a couple of years ago when we had a 911 call that got a lot of attention, and I did enough questions with Dr. Miller to understand the 75 people who are doing all the work. And perhaps other days it's an indication as an emergency that I don't have a lot of questions, but it's a thank you for your leadership as well as the team and all of the other 70-plus people who are a huge factor in whether people get help fast enough to live. So just thanks.
Excellent.
Mr. Chair, if I could ask for a point of personal indulgence if there's no more questions.
Absolutely, Mr.
I'm going to
Miller.
embarrass Director Flagler and the staff. They've just returned this week. They have a soft spot in my heart. Not that the fire department, police department, and IT don't, but they've just returned this week from the Virginia Emergency Management Symposium. And they're being bashful in telling you 2 or 3 things happened at the statewide emergency management conference. Jeff Bergen and the financial unit were recognized as the Cost Recovery Center of Excellence for the year, highlighting their work for a 98% cost return from COVID funding from FEMA.
Excellent.
Almost $36 million or so that has been approved by FEMA for reimbursement, waiting and working through its channels with the state in some various stages. The second thing is Lucia Cortez, who is responsible for community engagement, was awarded as PIO and Engagement Coordinator of the Year for the entire Commonwealth.
Excellent.
For her efforts to increase CERT with the Spanish language program and Teen CERT. And the Watch Desk was asked to present to the statewide conference on setting up a watch desk because it has been so valuable. We had an EOC exchange program. Sydney McKenna, who leads planning, Will has had the emergency managers rotate across the region throughout other EOCs, including the District of Columbia. So he presented on that experience. And finally, not to save the best for last, Will was recognized as the Emergency Management Professional of the Year for the Virginia Emergency Management Association. So, kudos to them, gold star. All the
Go
way across.
team. Go team. Oh, it's fantastic.
So this is a department that covers its expenses for us.
Hard to.
Go ahead.
Only
Mr.
the
Chair.
birth of a child could make you not want to highlight that, right? It seems insignificant.
I can't
by
remember.
comparison.
What are you talking about?
Can we get some good-natured
Thank you.
competition between Jeff and the cost recovery statistics here and the treasurer on their lower delinquency rate? Which is more impactful?
You're a solid gold on public
Thank you.
outreach.
Thank you, guys.
You work with some
Thank you.
absolutely amazing professionals.
Thank you all.
Aaron, thank you for saying that. We would never
Thank you, Aaron.
there, leave there.
Seriously, right? It's a modest guy, modest guy. Sheriff, they're not leaving because of you. They're just getting water so that they're fully engaged for you.
Say.
Like, wow, all of a sudden.
Yeah, I know our sheriff has been very patient listening to everybody else, and I promised him that the artifact of the sheriff going last, maybe that'll be fixed in the future. We'll have to see.
I thought the sheriff was here because, as we heard at the start, they are a public safety team and community, and I thought that they were just all here to support each other. I didn't realize that you were waiting unduly long, so I apologize.
Oh, no worries at all. No worries at all.
I'll turn it over to our sheriff.
Thank you so much. Well, thank you, Mr. Chair and the board. Thank you for allowing us to be here today. We can move to the next slide, please. So our first slide talks about our agency goal, and there it is. So it's to be a model sheriff's office known for the high quality of work, dedicated service to our community, and the excellence of our people. And then we have our 5 sheriff's office values: integrity, respect, teamwork, commitment, and diversity. And these values were something that the entire leadership team, from the newest sergeant up until the sheriff, we came up with these values together as a team. Next slide. So this next slide is an overview of the sheriff's office, and I want to highlight a couple things. We have a full-time nurse practitioner and registered nurse that are specifically dedicated to the medication-assisted treatment program. This includes placing those in our care in the jail on the program, monitoring these folks, induction of the medication, and issuing of the medication, which is very, very important to combat the withdrawal process. We've worked with DHS to bring in consultants from the Health Management Associates, HMA, to ensure the proper implementation and policy creation for the medication-assisted treatment program. Each resident in the jail is assigned a tablet upon commitment to the detention facility, and these tablets offer free options which include music, books, both educational and religious, movies, and there's also an option to purchase premium content if that is what they choose to do. We're upgrading our scan tour system, which is what we use to document our security rounds in the detention facility. So staff will no longer be required to manually input these security rounds into the computer, which allows for more engagement with the population inside the housing units. The system will automatically integrate with our current records management system. And the way the system works is staff will scan a wireless tag device that's attached to the walls of the housing units that are securely placed in the housing units in different areas of the facility. Also, the biometric sensors, that's something that I'm working on, that we will implement, the biometric sensors, and these would be an additional layer of protection for those housed in the medical housing unit. Again, this is an additional tool that we would use along with the 15-minute rounds that we currently conduct, the 4-hour vital checks that are done, along with our full-time doctor, psychiatrist, and the 24/7 care that is available to those in our custody. Next slide, please. I'm very proud of this slide, the community partnerships. This is something that's very important to me. So the Sheriff's Office is committed to continuing community engagement and partnerships. I'm very proud and thankful to the police department that I recently assigned a deputy sheriff to the police department's community engagement division. This deputy will be that's assigned is bilingual, so she brings diversity, and she's a military veteran. So thank you again to the police department for the opportunity. One of my goals is to have representation at as many community events as possible. I do want to highlight one of the photos there. That's Lieutenant Pitts in the black polo shirt at Culpeper Gardens. We went to visit residents at Culpeper Gardens for the holidays, and it was extremely, the staff were just overwhelmed with joy for doing that. Thank you. Next slide. This next slide captures statistics from July 2022 till February of 23 that demonstrate what the detention center staff are working with and dealing with on a daily basis. There's more substance use and withdrawal concerns, more medical concerns, mental health concerns, and overall a more challenging population that requires staff to put on many different hats when interacting with those in our care. I do want to highlight that we have 14 Department of Human Services staff members on site who have just extended into evening and weekend coverage, which is exceptional. We have a full-time doctor and a psychiatrist with on-call availability after hours. And while it may look like we have a more manageable average daily population, 11 of the categories on that slide have increased over the past year during the same time frame, with almost 100 less commits into the facility. So we anticipate these numbers that will continue to trend up. Our average daily population has increased from the low 200s during the onset of COVID to around just below 300, and the numbers keep trending up as we get further away from COVID. Next slide, please. This slide is specific to our Judicial Services Division, which includes our court security, civil process, and transportation sections. Evictions are continuing to grow due to the legal moratorium having expired, and the increase in scheduled outside medical appointments and mental health transports to state hospitals has also increased. And since July of last year, 2022, we've also staffed 16 county board meetings with 2 or more staff at each meeting. Next slide, please. So this slide breaks down our staffing levels by division. To your far left is the Corrections Division. In the middle, you have the Judicial Services Division. And to the far right, you have the Administrative Division. We have 65 total vacancies, which is 34% below our authorized levels. 21 of the 65 vacancies are functional, which means that we have people hired for these positions, but they're in a training phase. Our training consists of 6 months of academy instruction, followed by 12 weeks of field training with to be fully certified. These vacancies definitely make it very challenging to keep up with the everyday work that we're required to perform. As you can see, the most affected division is the Corrections Division, which is the detention facility staff. And while our average daily population is lower than in years past, we do have to consider the classification, types of individuals in our custody, security, and the charges of those housed in our facility, which is why we can't just close down another housing unit. We have to take these things into consideration. We won't be a direct supervision detention facility where programming and preparing individuals to return to the community is vital with the staffing the way it is. We don't want to just warehouse individuals. That's not healthy or productive for anyone, and especially those in our care. We're short-staffed in every division, which makes it very challenging to complete our day-to-day operations. Some reasons we believe why staff are leaving are higher pay, other agencies offering bonuses, and staff who want to be more what we call on the road or patrolling, similar to the police department's responsibilities. I want to note that 30 of the individuals that have left the sheriff's office have gone to local police departments, and only 3 of those that have left the sheriff's office have gone to full-service sheriff's offices, similar to Loudoun County. Next slide, please. This slide breaks down the amount of overtime by shifts on the left and overtime hours on the right. So just for context, each jail shift is 12.5 hours long, and we're currently still mandating overtime, which causes burnout and staff wellness to be affected. Mandating overtime definitely affects staff morale negatively. And as you can see from this snapshot, the need for overtime in January and February is increasing each year. My leadership team, we've discussed different shift and staffing options to possibly ease the burden, but we haven't yet found a better solution for this. We have to modify operations to some degree every day. We've had to modify operations every day to some degree in the detention facility in FY22, and we're projecting the same in FY23. And when I say modifying operations, this includes more lockdown of inmates, residents in the jail, more modification of out of cell time, canceling programs, and canceling visitation. Next slide, please. Take a sit here. This slide highlights the work that the Sheriff's Office has done and our continued commitment to equity. My team is working on a plan that would allow residents to start paying off their court fees while they work in the detention facility. This would allow the folks in our custody to take one more thing off their plate before they're released. Workforce pay was doubled for all positions in the detention facility, and we use canteen and commissary funds to pay for this. The jail library was upgraded to be more reflective of the community we serve. And I definitely want to give a big shout out to the Arlington Public Library System for their assistance with this. It's a very huge endeavor. And we curated a diverse and inclusive collection of books and magazines and research materials for those in our custody. We're continuing our work with the Challenging Racism program, and we've had many conversations and trainings, and we've included all supervisors at every level to attend these trainings. We're also working to internally form an equity and inclusion team. Next slide, please. And this slide is a summary of our proposed changes. We continue to focus on staff compensation and recruitment and retention. We were able to support the 8.5 salary and range increase by freezing the 10 deputy sheriff positions and added one-time funding for recruitment efforts, which is definitely important and key. Next slide, please. My last slide, almost done. These considerations that you see before you are key to the Sheriff's Office commitment to providing excellent service that our community expects and deserves. As you can see, I have pretrial there noted, and it's no secret that our pretrial numbers have gone up and continue to stay higher than usual. We still only have 4 pretrial officers managing a higher caseload. Prior to COVID, they were managing around 50 cases each, and it went up to 80 during the height of the pandemic and has only come down to about the mid-60s, low 70s for each pretrial officer. Our recruitment efforts are another one of our top priorities. We desperately need a permanent position dedicated to overseeing our recruitment efforts. Currently, we're using our Sheriff's Intelligence Unit sergeant to do double duty, and he's doing an excellent job. I want to take this opportunity to definitely give him a shout out. Retention. So once we recruit qualified candidates, retaining them is just as important. The sheriff's deputies in Arlington County are law enforcement certified, along with court, civil process, and jail certifications. So equitable pay would keep these law enforcement officers in Arlington County. Many individuals commute from other areas in the DMV, and equitable pay would be a reason for them to continue commuting into Arlington. So I really want to thank you for considering the 8.5% for us to stay competitive. Thank you so much. We're still mandating 2 shifts of overtime in the detention facility, and that, even with that mandate, it's still not getting us to the minimum staffing needed to run the facility without modifying operations. We don't have the ability to not cover certain posts in the detention facility, so we need staff in order to continue the operations in the facility running. Staff wellness remains another top priority. One way we're addressing this is we're going to move our staff gym that we currently have on the first floor to the third floor of the detention facility and convert the first floor gym into a relaxation, quiet room for staff. This was actually a staff recommended idea, very proud. So they said they don't have a place to relax, and that's very, very insightful and important. So we've ordered furniture that will give staff the ability to relax in between shifts or while on their 30-minute break. We've also added a ping pong table to the staff dining area, and they have some pretty good competitions up there. And we're considering adding a pickleball court for staff on the third floor of our detention facility. That is all I have. Thank you so much. Open to questions. Thank you.
The pickleball thing, it's too easy.
I
All right.
know.
Yes, Krista.
Just be prepared for noise complaints from the residents of the facility is all I'm gonna say.
The nurses.
Thank you so much, and thank you so much, Sheriff Gross, for sharing this picture with us. Certainly, the recruitment challenges here are enormous in retention, as they are with other branches of law enforcement. I appreciated your sharing that there's actually not someone dedicated to recruitment. It sounds like an amazing team member doing double duty. To what extent are you envisioning that the $100,000 included in the budget for recruitment would go towards recruitment activities or some human resources to put towards recruitment relative to bonuses for retention or recruitment?
You want to take a shot at that one? You know, and one thing I didn't do, I failed to do this, and I apologize. I didn't introduce my staff. And my staff, I couldn't be here without them. So this is Major Gretchen Foster. I have Chief Deputy Tara Johnson, Major John Burgess, Major Jimmy Barrett, and our budget analyst, Fabiola Brooks. I apologize for that.
So according to Chief Johnson.
If you wouldn't
We
mind
need
just.
to have you turn your microphone
Sorry about
on.
that. According to Chief Johnson, 30% of that is going to recruitment, and then 70% is going to the overtime it costs to go to recruiting events.
Fantastic. Okay, got it. So, so more of it going to recruiting events, that's someone's time, right? And so you were saying, so the 30% that's going to recruitment itself, what is that,
So-
materials or?
We have to pay to go to recruiting events a lot of times to get in the door.
Yeah. Okay, so it's covering those fees.
Right.
And one of the things that our sergeant did, thinking outside the box, he has now set up a station outside of Walmart's. And so he's outside of Walmart, engaging the community and talking to folks. And he's done a lot just by doing that, and that is free. So our folks are also looking for free opportunities to, put our name out there. And honestly, a lot of folks don't know what the sheriff's office does. So telling our story and just sharing what are the duties and responsibilities of the sheriff's office.
Especially in a community that also has a police department, which isn't
Correct.
the case in everywhere, and even Northern Virginia.
Yes, correct.
Thank you so much for that insight.
Indeed. Mr. DeFranti.
I think I'll just dovetail that the recruitment piece, I'll be working on the math of 65 positions and 10 frozen, and if there's a way to find the resources for that recruitment position. I can say it's great to hear about the nurse, the physician's assistant, I believe you said, and the investments there. Certainly the amount of overtime being worked is on my mind quite often, along with the health and safety of those you serve, your guests. And then just a thank you to the whole team in addition to you for weathering this overtime challenge.
Thank you.
Thank you. Mr. Carantonis.
Thank you, Mr. Chair, and thank you, Mr. Quiroz, Sheriff Quiroz, for hosting me today, giving me a tour of the entire facility. That was really extremely insightful, and thank you, everybody, for your service. We understand that it's not only, this is a thank you that goes to both ways. It's not only because we know that's very important what you're doing, but we know that you're also going many extra miles in doing it. But one thing that I'm trying to understand is, so the fact that you are struggling with the vacancies right now, how much has it increased the likelihood of lockdowns, and what kind of lockdowns have we been seeing happening? So that's to me is an important. measure, right? Because the consequence of the vacancies is not only the fact that you're, pushing an enormous amount of overtime, but with the consequences that you mentioned, but also the fact that we have lockdowns in the jail.
Correct. And the lockdowns obviously affect those in our custody, but it affects the staff as well. The facility was built to interact with those in our custody and our care, not to have them behind the doors. So I will say that I'm pretty secure with saying that we've had modified operations every single day so far in 2023, which requires less recreation, cancellation of visits, like I mentioned. The staff, when we don't have adequate numbers to start the day off, then no one can come out. So if you have to add anything to that.
Also, for the previous fiscal year, we've had to modify every single day to some extent, not only just to our staffing being short, but we've seen an increase in TDOs, ECOs leaving our buildings, hospital transports. All of that require 2 deputies to go with each one to the hospital. Some days we have had 3 ECOs and a hospital transport, and so we would have 5, 6 deputies out at the hospital while still trying to manage the jail. When we do lock down, we don't lock down generally for the whole day. And then sometimes when we have to modify, it might be a couple hours of the day. But nonetheless, normally they wouldn't have to be locked down for that much time if we were on normal operations. So sometimes it's not all day. Sometimes it's just until we can get the deputies back to the facility after they've transported out. But virtually every day, we anticipate this fiscal year as well, every day being modified.
Thank you. So would there be a staffing level in between the correct or the appropriate staffing level and the current deficient staffing level that you would say that staffing level would minimize the possibility, the probability of having lockdowns or reduced? Is there somewhere between these 218 plus correctional personnel, is there a staffing level that you would say, yeah, if we had these additional 3 or 4 people, we wouldn't have lockdowns?
I think definitely, yeah. I mean, we're very low. It's low right now. But for context, I think in 2001, when I started, each day shift had 33 staff on shift. Now we're at 23 on a day shift. Each night shift had 23. Now night shifts have 15. So the building is made for staff. We need folks to staff these posts. We can't leave them vacant. So we're pulling the resources to which.
I may add to that I saw today that this, of course, affects also the medical ward and also the mental health wing or ward. I was quite impressed by the fact that there was only one supervising deputy there, besides other personnel, but one uniformed supervising person. Thank you.
Ms. Garvey.
Yeah, thank you. And I look forward to my tour. I know it's coming up, so
Yes,
I look
thank
forward to that. Thank you. It's been a long time since I toured the jail. I always find myself with these presentations remembering the statistics, which I'm guessing hasn't changed, that most people get their mental health therapy in our jails and prisons because we do such a bad job with folks. And, when you describe the needs of your population, I'm almost feeling like you are a branch of DHS, which is different, which is why, what does the sheriff department do? Well, it's kind of interesting, and I think our traditional view of it is really continuing to change. I was really pleased to hear about the tablets.
Yes.
I think that's great, and the GED, you're getting your GED awarded going up, that's great. And I find myself wondering, are there some other performance measures? I'd kind of like to know, I'm interested in, when people leave, what happens to them when we leave? It feels like if a good enough job is done with the mental health therapy that they're getting in the jail, that, you won't have as much recidivism, that people may get on with their lives, that it may actually be a good thing for them. That may be a little Pollyannish, but it might be possible and maybe even happens. But I don't know if there's a way to keep data on that or keep track of that. I know you don't now, but that might be something to think about, to kind of highlight the other work that you really do in a way.
Right, and one thing I'm thinking of is the community readiness unit that we have. So we have a housing unit specifically dedicated to getting folks ready to go back into the community with therapy, courses. We have a flagger course, which, when you get out, you can learn, you work in the construction site as a flagger. We have several programs that work to integrate you back into the community, which is one of the focuses of the unit.
We do also have DHS, reentry managers as well in our jail. It's some of the 14, that if they're getting released into services from DHS, they keep a tab on them, get them in services when they're released there. And we also have a reentry inmate service counselor who, upon people returning to the streets, like if they need assistance with like a homeless shelter or a shelter of some sort or OAR, we set them up with those as well for assistance. But we would have to try to come up with a plan to keep all of that information overall together.
Yeah.
It would be hard to keep track of for very long.
It
I anticipate.
probably would, but it's just something to highlight what you do, because you feel like more, people have a classic view that, people get locked up and then they get let out and you kind of forget about it all. But you're actually part of our continuum of services in a way.
Yes.
So I would, if, maybe in the future there's a way to kind of capture that a little bit. One last question really quick, Mr. Chair, if I might.
Please.
We have 160, that's the average state level folks in the jail, which doesn't ever seem to change. My memory is there's a real big difference between what the state gives us for their funding and how much it actually costs to keep those folks in the jail. Am I remembering correctly?
Yes, I do not know the number off the top of my head, but there is a difference. But it becomes once they're out of compliance. So it's like a certain amount of days after the state receives their court paperwork, and they have so many days to get them. And once they're out of compliance, they become the state. That's when that fee. Yeah, the responsibility of the state is, but it is significantly lower than what we pay.
Yeah, I think that used to get highlighted a lot. It's not a bad idea to just keep highlighting that. It's just another one of the debts that the state tends not to cover.
We do have very few out of compliance, though. There used to be a time when we would have 80 plus out of compliance, and I think the last time I saw, which a week or two ago, it was in single digits.
So when they're in compliance, they're actually paying what it costs?
No, only when they become state responsible do they pay us.
Yeah, that's what I'm kind of getting. I just think it might be a good number to have available. Thank you. Thank you.
Yes,
thanks very much.
Thank you.
Thank you. And for me, I'm noticing that, it appears, if I'm interpreting these measures correctly, of the people who advance to the stage where you conduct a background check, a relatively minority fraction percentage of the applications that you receive, an even smaller minority actually end up being hired, like 4.5%, like who we've invested in screening and doing a background check on. First, is that like typical with the history of the Sheriff's Department? It seems over the past few years it is. Is that typical across other sheriff's offices?
It seems like it's trending that way, yeah.
Wow.
And, we want to be very selective and careful of who we bring into our facility and who's, going to be working with our community. So.
Yeah. I'll just resuscitate a suggestion, that I talked about with the police department. Maybe there could be some joint efforts at a sworn officer pipeline initiative that really tries to get Arlingtonians who were in those early stages of high school.
Correct.
It just seems so incredibly inefficient to try and, build up strength when these kinds of numbers of successful hiring. Not that you're not successful in your efforts, but it's just, we're selective, people have choices, it's a lot to do it at the back end. Maybe if we can just make some significant investments at the front end, it can pay some huge dividends. And I, for one, wouldn't be too upset to see a lot of Arlington kids becoming Arlington sworn law enforcement officers.
Absolutely. So here's one.
Exactly, exactly. See, you can become sheriff. So I see no other lights on, so at this point, thank you. Thank you,
you so
Sheriff
much.
Quiroz,
Thank
and
you.
everyone for your patience in staying with us.
Thank you.
At this point, we're going to be back in the boardroom next Tuesday, March 28th at 7 o'clock for a public hearing on the budget, and then 2 nights later on Thursday, same time, for a public hearing on tax rates and our various fees. So please join us then. Before I close this out, I am going to do something that I am usually loath to do, but I can. And if you all will indulge me, I would like to, on this day, wish my 11-year-old daughter a happy birthday. I think she may be watching at home, so happy birthday, Mila. I love you.
Happy birthday.
Thank you. Thank you all for that. With that, we're adjourned.
We could even sing this.
Yeah, well, maybe we couldn't.